Okay, can I begin the meeting by welcoming the officers that we've got with us? That's Susan, the Chief Executive Officer. Thank you for coming, Susan. And Meredith Peachy, the Public Health Consultant. We've also got Nigel Bailey, Mick Austin and Sarah Lynch, who are going to be joining us for talking about the Travellers item. The first agenda item is apologies for absence. We have apologies from Guy Granderson, and I'd like to welcome Emma Hobbs, who's his substitute this evening. As we were saying just now, if you want to speak, can you please put the icon up for your hand, because I can see that, and I'll ask you probably in alphabetical order. When you're not speaking, can you turn off your video and your microphone? Then we all get a better signal. And if we have any voting, then I'll do that firstly in alphabetical order, and then if we have another vote, I'll do it in reverse alphabetical order, so that's fair. Neil, are there any other apologies?
We could raise our hands instead, Pauline. By raising our hands, and when you vote, we could vote by raising our hands.
Well, it's easier if you press the icon, because I can then see who's waiting. Whereas if you haven't got your video on, then I can't see you.
I just meant for voting. We could vote with our hands.
I can't see everybody at once. That's a problem. The screen's is not big enough. We don't have many votes. So when we do...
Did Michelle need the hands up function?
Well, if you go onto the little bar, you've got video, the microphone, an arrow, then 3 dots, then a hand that says raise your hand. So if you press on that, then that works. If something doesn't seem to be controversial, then I'll just ask for people to let me know if they want to vote against or if they want to abstain. If it looks a bit more controversial, then I will ask you by name to vote. Right then, yes.
I don't have the hand function. It might be because I'm showing as a guest, which I don't understand, because I clicked on the link in Neil's email, in my councillor email. Right.
In that case, Alison, if you want to speak,
I'll just physically put my
video on and put your hand up.
Okay, thanks, Pauline.
I can see one person at once. Anybody else who can't use that icon? Right. Okay. Let's move to the minutes of the previous meeting. Are there any matters arising? If not, would somebody like to propose them as a correct record? In which case I will do that. Can somebody second them?
I will second that.
Thank you very much, Alison. Is there anybody against or wanting to abstain? Okay, then those minutes are passed. Thank you very much. Right now, declarations of interest. Are there any, Neil? Any declarations of interest?
I think that's for members to announce if they have.
Sorry, I didn't mean Neil, sorry. Anybody want to declare an interest? Okay. In that case, we move to public question time. That was what I meant to ask Neil. Are there any public questions?
None received, Chairman.
Right. Okay. And I have got a member question, which is from Caroline Smith. Caroline, I think you're there. Would you like to ask a question?
Would you like me to read it out? Or
I think so, because there might be people listening who don't have a copy.
Okay, then. One of the alarming statistics to come out since the beginning of COVID-19 pandemic is that certain ethnic minorities are disproportionately represented in the number of deaths. What is Wokingham doing to help understand why this is happening and going forward, trying to reduce this aspect in the event of a second wave of COVID-19? Thank you.
Thank you. That's a very relevant question. The answer is that Public Health England has published a report in June 2020 entitled Beyond the Data, Understanding the impact of COVID-19 on black and minority ethnic groups. The report confirmed that death rates linked to COVID-19 were higher for black and Asian ethnic groups when compared to white ethnic groups. The report made a number of recommendations around improved data collection, community research, health impact assessments, and occupational risk assessments. It also emphasised the importance of targeted education and prevention campaigns and ensuring that COVID-19 recovery strategies actively aim to reduce inequalities caused by the wider determinants of health, such as education, attainment, income and housing. The Council will be working with Public Health England, other health partners and the BAME community to understand and address local issues in order to mitigate the impact of any future COVID-19 outbreaks. In the meantime, the Council has designed an individual risk assessment to support its BAME employees in considering any additional measures that may be needed to ensure that they are protected and supported. That's the end of the answer, Caroline.
Thank you very much. That's very full. Thank you.
Do you have a supplementary? You don't have to have.
No, it was just I was trying to remember because there's quite a lot of information there. Can I have it written down as well, please?
Yes,
Is
indeed.
that possible? Thank you. That'd be lovely. Thank you.
I'll request Neil Carr if he would email that to you probably tomorrow morning.
Okay,
thank you. Very much, Steve.
Thank you. Bye.
Bye-bye. Right, now we move then to agenda item 17, the COVID-19 Outbreak Management Plan. We've had a very, very detailed and excellent report already, which I'm sure you've all read. It's extremely comprehensive and it shows a massive amount of work that our officers have done over the last few months. So, Neil, can we minute a big thanks to those who compiled it, the report, and to Susan and her team for all the extra work they've put in, because it's an absolutely magnificent document. And to the members, when you want to ask a question about it, could you please give the page number and the paragraph number, and give us a little bit of time to find it, so that we can make sense of what you're asking. Now, Susan, do you want to say something, or Meriden, do you want to say something about the report first, or shall we move straight to questions?
I think, Chair, it's Susan here. If I can, I'll say a couple of words and hand over to Meriden to give an overview. So, as you say, Chair, there's been a huge amount of work that's gone into this outbreak control plan, and it's all about having a robust and safe way of managing outbreaks in the borough. And really this is about us being clear on our roles and responsibilities in managing that outbreak, and you'll see that from the document, and ensuring that we're coordinated across the area and beyond with national organisations, and really taking a whole system approach to this. So I'm not going to say too much, because, as you say, there's a lot of information in that document. If I hand over to Meriden, Meriden is our specialist in this area. So if I can hand over to you, Meriden, thank you.
Thank you very much, Meriden.
Thank you.
Go ahead.
Joining you.
Right, go ahead, Dan.
I'll give you a brief introduction to some of the key items in the plan. It's a unique opportunity for local authorities to be doing outbreak control planning. And it was actually mid-May when councils were asked to come up with an outbreak control plan, and we published it within a month, which is no mean feat. And I mean, the purpose of the plan, as Susan was saying, is councils have a unique opportunity to help socialise the message of social distancing, why you need to isolate, what it means if you're a case or a contact, and to work with all our local businesses, schools, care homes, to help implement all the myriad of policies that are coming down. They're all important policies, and it's all about, at the moment, trying to prevent a second wave. So we have an opportunity to be a big part of that. So if you're looking at the plan, this is partially a prevention plan. How can we work with all our partners to prevent outbreaks, to make sure our schools continue with the children in bubbles, so that if we do get a case, only a bubble needs to isolate, not the whole school. Care homes, we have an enormous piece of work around the care homes task force, led by Matt Pope, and we've done a huge amount to keep our care homes safe, safer than they were in the early part of the pandemic. So those are the sorts of things we can do. So I just thought I'd highlight a few things, because this is also an emergency plan. It's about how we respond to an outbreak, how we find out about it, what happens to the information, and all the governance to do with information. And you will have heard a lot in the press about public health directors saying they don't have enough information. Well, you know, this week I've been given access to postcode level data, patient level data, or people level data on testing, on results, negative, positive. So we're now getting to a point where we have all the data that we can now use to help us prevent and manage outbreaks. So just looking at the plan, I'd like to take you to page 12. Because one of the important things is, how do we know if there's a potential outbreak? So we've set up a notification system, so that what happens is there are 3 tiers of NHS test and trace. Tier 2 are your professionals, they're doctors, nurses, health professionals. Every positive case in the country, they will ring them, they will ask them about their personal circumstances, they'll ask them where they work, where they've been, have they been to a cafe, and they will ask about their contacts. And they will collect all the contacts. If it's straightforward, all those contacts will be referred on to tier 3, who are call handlers, and they will ring them all and say, you're a contact, you've been in contact with somebody who's positive for at least 15 minutes, within 2 meters, you need to isolate. So that's what will happen. Now, what happens is they can also identify if somebody's positive in a care home or a school, or if there are 2 cases where people work in the same building. This is where we come in. They will automatically notify us. We will then be part of the solution. And this is where the notification system comes in. So what you will see is Public Health England will be notified if there are 2 cases in a business or if there's a case in a care home. That will automatically go to our front desk, and we're using environmental health officers across all of Berkshire, and for us it's the PPP. They will automatically receive it, and they are open the same hours as Public Health England and on the weekend. They monitor their emails hourly. They will automatically be in contact with Public Health England. They will then contact the health when they need to take action. The health protection cell across Berkshire West includes people like me, and it means that we will always have public health consultants, we will have communication experts and practitioners, and the council can call on that group at any time. So for any potential outbreak, there will be somebody from the health protection cell, there will be Public Health England, and there'll be a subject matter expert. That subject matter expert might well be, I think Nigel Bailey is here tonight, might well be him. It could well be somebody who's responsible for libraries. It could be somebody who's responsible for care homes or schools. So the council has identified all of those subject matter experts, and they are ready to be part of a team. Then you will see, we will determine, is it high risk? If it's high risk, we are likely to have an incident control team, which is normally led by Public Health England, but it might be led by Council Public Health, depending on how many incidents there are around the country, how much Health England people are available. So we would have an incident control team meeting, and quite typically, I'll give you an example, they had an incident control team for a BMW factory. there were a number of people who were positive, and they decided, the incident control team, they needed to test everybody in the BMW factory. They were able to mobilise 400 tests on site to find out how many staff were positive and how many staff need to isolate, because we do know not everybody has symptoms, which is why if you've got a number of cases in a building working in the same place, we need to test everybody. I'll give another example. In Kent at the moment, they've just tested 4,000 staff in a hospital because there's outbreak amongst a number of staff. So those are the sorts of things that we can do. The other thing an incident control team might do is Blackburn and Darwin. They've had some outbreaks, but what they've found is it's quite a lot of the Asian community. And what they're doing is the Asian community, even though 6 households can get together, some of the Asian communities are a lot bigger than most, and it's ended up being quite a big gathering. And so the spread has been quite substantial. So they're working with the local mosques and the local people to try and change the levels of contact amongst some of those communities. So those are some of the sorts of things you can do if you know your local community. And that's why an incident control team is actually really important for the council to be there with Public Health England and with public health experts. Now, if you go down to the right-hand side, the low risk, if the outbreak is not particularly complex, it might be one case in a care home, it will be for the local authority to set up a response team and manage it itself. And typically, we've already got the Care Homes Task Force. They basically are a local response team, and they have all sorts of ways of talking to our care homes, talking to them about infection control, talking to them about how to get testing done, what to do with staff, potentially if symptomatic or have or need testing and are positive, what to do about family connections, and also what to do about visitors. And that would be a point we'd step in and say, probably if you've opened up to visitors, probably no more visitors for the time being. So those are the sorts of things that a local authority team could do. Equally, it could be one positive case in library staff, and that would be considered low incident, and that would be for us to manage. We might want to relook at our cleaning facilities in the library. We might want to look at how many people have been in the library. Did we follow all the social distancing and those kinds of things? So this flow chart is quite important because it tells us the process of how we manage outbreaks. It's like an action card to us. And then there's a number of escalation routes. If we do have a significant outbreak, we may need to set up our own gold command, and we've all got all the processes ready to set that up if we need to. It might be a quite significant large outbreak. It might be across a number of council areas. Then the Health Protection Board is set up for Berkshire West, and they are looking at all the policies across the 3 Berkshire councils, and that includes all the chief executives and the NHS and everyone else. It may well be something that involves the NHS. The LRF are there to support us when needed. They're not managing part of this system, but they are there. If, for example, it was an outbreak across, let me see, it might be Reading University, when they're back in university, and that might involve a much bigger area because that's partly our area, partly Reading, and students will be living in a number of different places. And then the PHE Regional Oversight Group is there to look at, they're looking for hotspots, they look at the data across the whole piece. So that is the formal system. So I just thought that's one of the important things in this plan is the process of how we're going to be involved and how we manage and prevent outbreaks. The other page I want to draw your attention to is page 14. And this is the governance for Woking Borough Council. And you'll see that we have the Local Outbreak Engagement Board, which is chaired by the leader, and it is recommended in all outbreak plans that the leader chairs an outbreak board, which is a mechanism for talking to the public. And we have set that up. That started a couple of weeks ago. Then there's the Thames Valley Local Resilience Forum, Public Health Berkshire. What we've done in Berkshire is we've been advised to have a health protection board, and we do that across West Berkshire and East Berkshire, and I happen to be chairing the board for Berkshire West that brings the three councils together. It helps us with economies of scale, and we also have a lot of linked services. We're linked with the NHS in particular. There's one CCG for Berkshire West. We've got the Berkshire Hospital and the BHFT Trust for Community Mental Health Services. So they are all part of that board. And this plan, you'll notice at the end, has got lots of plans for whether it be libraries, for our care homes. You'll see there's one on transport. The NHS is not there yet. We're just waiting to sign those off, and we plan, certainly in the next iteration, to have a plan in there for primary care, one for BHFT and one for Royal Berkshire Hospital. And one of the scenarios I've asked them to put in is, what would you do if you needed to mobilise 4,000 tests and you had an outbreak amongst staff? So those are the kinds of things that we need to scrutinise at the board, because that would hugely affect social care. Once you start potentially locking down a hospital or community services, it makes a huge impact on social care, let alone the public visitors and everything else. So that's and as I say, it's very clearly got the PPP front door, and we've worked very hard on all the algorithms that the PPP front door work on what they do when they receive data or information about a potential case. The other thing I just want to go back to page 12 on, because all the public have a role here. You'll see at the top, on the right-hand side, it says local intelligence. The reason we have that is from NHS Test and Trace. You'll have heard from ministers, that is, Sage has said, if there's 80% of cases that go through NHS Test and Trace, they think that's acceptable. It does mean 20% of cases are not followed up. And we may have heard in the press that Blackburn and Darwin, only 40%. Well, it just so happens in Wokingham, we're around 82%. So there is quite a high number of our cases that are actually followed up. And there's even higher percentage of contacts that are followed up. So that's quite good. But we are still left with around 20% of cases are not going through Test and Trace. So the ask of the public and members is, if you hear about a potential outbreak, contact PPP, our front door direct, and they will find out if PHE know about it or not, because we are going to rely on some local intelligence to let us know if there are outbreaks that we haven't heard about. And we do know there was an interesting case of a pub in another part of the country. One of the staff members were positive, and they thought, oh good, we can hand all the information we collected on the people who attended, their names and phone numbers, to Test and Trace. Well, what they found is that they collected only the first names, and most of them gave a wrong phone number because they didn't want to be contacted. So there was a problem. A lot of the contacts couldn't be contacted through Test and Trace. So what the council have done is use their own local intelligence and put out some local media in certain parts to try and get people to come forward and say, there's an issue at this particular pub, and they've quite sensitively talked to the public about how they can come forward. So these are the sorts of cases and intelligence that we need to know about, and it could well be that somebody locally could have rung us and said, oh, I've been in contact, what do I do? Now, our phone line at the council, they've already been briefed. If anybody rings about COVID-19, they automatically come straight through to either the PPP front desk, or it's referred to one of us in the outbreak control group. And we have a quite tight-knit outbreak control group within the council who are very up to speed, not only with what Test and Trace is all about, but they even know how to talk to someone about how to do your own test if necessary. So we're quite well set up. And the rest of the plan really talks you through how all the teams within the council have thought through themselves. How do we help prevent, and what might we do in the case of an outbreak? So I hope that helps to give you some background to the quite long, detailed plan. In the past, we've not always published emergency plans like this. This is quite unique. And what we plan to do is update the plan at least once a month. There are going to be changes in policy. There was another one today on care homes. And as I say, we will be putting the NHS plans in at some point. So I hope that's helpful, and I'm happy to answer questions.
Thank you so much. It's extremely helpful, extremely comprehensive. I'm sorry if you can hear me echoing. I don't know why that is. But that was fantastic. Excellent report. I've got Emma who wants to speak, and Andrew, Sarah, Jim, Paul, and Rachel. So, Emma, would you like to go first?
Thank you very much, Madam Chairman. Hello, Meriden. It's Emma Hobbs here from Charville. I have a question for you. I had a complaint from a resident the other day who attended a hairdresser in Wokingham, where she walked in. The place was absolutely heaving with people. This hairdresser was even consultating in the reception area. She, in the end, left and mentioned it to me. Would you like me to contact you with the name of the hairdresser?
Thank you, Emma.
That would be very helpful, because we have guidance for businesses, and if necessary, we can actually visit and we can talk them through. So the answer is yes. It would be very helpful to know. Thank you.
Okay, I'll do that for you.
Thank you. Oliver.
Yes, hello. In the that was very interesting what you said. Were we involved in the Tesco case, where 2 of their employees were found positive?
That's a very interesting one. We found out about it through the press. We weren't notified about that one. And there are some things, the systems are still getting up and running. And I think we all learned in the press that Tesco said these 2 particular positive cases were over 2 weeks ago. And that was before the official date that our PPP started. Public Health England did know about that. They'd been in contact with them, and they'd given them appropriate advice, and they didn't think it was necessary for it to contact us at the point. This case happens to be linked to the one in Tesco's in Bracknell Forest. And there's been an incident control team in Bracknell Forest, and that has also picked up the issue about Tesco's in Wokingham. There has been no further cases in Tesco's in Wokingham, because it was now nearly 3 weeks ago, those cases. And I get daily notification of any potential outbreaks. But as I say, I will get notification of probably about 80% of cases. There is 20% that I won't hear about. We are in conversation with Public Health England about when they contact us. When they don't, the expectation is going forward that we will be contacted about all outbreaks where there's more than one case.
Thank you.
Andrew.
Yes, thank you, Meriden, for an extremely clear and very reassuring oral presentation. I really appreciated that. I'd like to ask questions around 3 themes, if I may. The first is communication with high-risk communities, including our BAME community, adults with learning difficulties, and the elderly. I note that you said that you have been reaching out to mosques, for example. My first question is, has there been any study of how effective WBC's efforts have been thus far at reaching out to these communities, even something as simple, as a focus group discussion with some of the gatekeepers. Now, I'm sure you already have that feedback from the mosques, for example, but I'm wondering about some of the other high-risk groups. My second question is about the community hub. Is the community hub still able to support, at very short notice, some people who may need help with essential supplies if required, following track and trace to self-isolate? And these would be people who'd be unable to access alternatives such as online shopping, deliveries. And my third question is, and personally, I would find this very helpful myself. Is there any possibility of being able to have some separate written guidance specifically for the roles of counsellors in the event of an outbreak? Thank you.
Meriden.
Yes, there are a number of really good questions there. I think I'll answer the easiest one first. On the community hub, the answer is yes. They are open for business. They've obviously scaled back, bearing in mind that shielded people will no longer kneel to shield shortly. They are still operating, and as a matter of fact, I meet with them twice a week with colleagues in adult social care. And I've provided a huge amount of support to the voluntary sector, both during the pandemic and also going forward. So, for example, working with the voluntary sector, I've helped them with a policy on, and this comes into the elderly and learning difficulties. I've worked with them on policies for transport so they can start supporting the elderly and people with learning disabilities, starting to go out, to go to hospital appointments, and to go out visiting. So we've got policies on that. We've developed policies on day centres so we can start having some of those services starting. We've also started developing a policy on visiting in care homes. So I think the voluntary sector have been an enormous support over the last couple of months, and I know some of them have now gone back to work, so I'm not able to continue supporting, but I can definitely say the community hub is still working. If anybody is isolating and needs support from the hub, it is there for them, and the same contact details are there. I think for any social care services that are related to learning disabilities and the elderly, there's quite a number of things that have been put in place. Firstly, anything to do with PPE. We've looked very closely at any risk situations, and PPE is available to all social and care staff where they may be in risk situations. So that includes children with disabilities. And I suppose, and the other one is social care looking very closely at how they can restart a whole range of activities. And we are looking at policies on safety on all of that. Communication with the high-risk communities. I wondered whether Susan might want to pick up on this one, because I think you've had some meetings recently with the BME community. Just to answer one question, I don't know of any evidence related locally. This could be that I've just not been in the patch long enough. I don't know about any evidence on the work that we do with the BME community at the moment.
So I
carry on, Andrew, if you've got something else you want to say.
No, carry on. Thank you.
Yeah.
Okay, so thank you. I attended the BME forum yesterday afternoon, and there was a presentation on the COVID in general and COVID and the impact on BAME communities, and that was reflected in the answer that we heard earlier from the chair. I think that there is more that we can do in terms of working with the BME forum in terms of engagement and communications in particular. There were other aspects that were mentioned about how we engage in particular with the BAME communities around sort of COVID. But if we talk about communications, then yes, I think there is more we can do, and I think that the BME forum is a great forum to do that. So there is certainly, if you were to talk to Dave as our head of communications, he would say that our communications is targeted at vulnerable groups as well, and that includes the BAME communities. So that absolutely is there. But at the same time, we have a lot ahead of us to do because of where we are in the crisis. So we're actually, we are moving, we are in the phase of as we've just talked about, the early phase of this outbreak control plan, and part of that is the communication. So we've got, as I say, we have a lot, more to do, and that will continue.
Thank you, Sarah.
Oh, thank you very much. Thank you very much for this report and the overview. It was really useful, really detailed. I've got sort of 3 areas of questioning. I guess a quick one initially. This just relates to page 21 of the document, where it talks about schools and how any outbreak there would be managed. I firstly wanted to clarify the fact that I thought that from September we were moving to whole class bubbles and no longer 15 children, and how that affects things. Does that have any impact on what's been written there? And also a little bit more about preventative measures specifically with schools. I mean, we've seen in the town centres there have been widening of footpaths to allow social distancing measures, but I'm not seeing anything around schools at the moment. And I certainly know that my kids' school, we have a really big problem. So I'm a little bit concerned about that and how we can put some preventative measures in there. But one of the other things I wanted to ask about is enforcement. Talking to the people I know that work in certain industries like shops, for example, pubs, I was talking to someone, I said, if someone walks into your shop without a face mask on, what can you do? She said, well, I can ask them to put one on, and if they don't, I can ask them to leave. And I said, and if they don't, well, there's actually nothing we can do. It's very difficult for us. I think, it's easy for the supermarkets. I do often see security guards outside, but I'm wondering what we can do as an authority to help with the enforcement of a lot of these rules, because I'm seeing that people are less cautious these days at the moment, which is a bit of a worry. The final thing I wanted to ask is about devolved powers to enforce any lockdown measures if they're required. I mean, I don't want to see us in a situation like Leicester. My understanding of what happened there was they actually found out about the situation via the news, via the media as well, because they weren't getting the information that they needed. I know that you said that you're getting more information now. Can I check firstly that the information you're getting is of the right quality that allows you to actually see well in advance if something is going to need to be done, so we're not in a situation where we're finding out things in the media? And do we actually have the devolved powers to allow us to act fully and appropriately? Thank you. So there's a lot there.
Thank you, Sarah.
There is. I'll answer some of them. I might need Susan's help, maybe on the enforcement one and how we can address that one, because that's a really interesting question. I'll start with your third question around the devolved powers and lockdown. We are expecting a bit more guidance to tell us exactly how that's going to work, but what the devolved powers means is that it will be through an incident control team we will have with Public Health England. That's where the decision will be made, and obviously with the council, but we will be able to potentially close shops or close parks or close businesses, that kind of thing. It's that kind of thing, and we won't have to resolve to the magistrates like we normally do. So it'll be a quicker process. So that's the sort of thing that we can do. If we need a much bigger lockdown, there is trigger points where government step in. Because if it's a lockdown like Leicester, then government will step in and they'll make that decision. But the local lockdown is about just partial. It's just some services or some businesses that we can do. And I think it's a really interesting one is what would be the trigger points for that. Now, the data is what's going to help us with that. Now, you're asking if we've got the data. I think we now have the data we need to make early decisions. And it's about how we use that information. Now, some of that information will be available to yourselves and the public. Some will only be available to us internally. And I think that's probably quite right, because some of that's people identifiable type data. There's a couple of things we need to look at to help us know if there's an outbreak. One is positivity rate. And that was what happened in Leicester. They moved from 1 or 2% of tests being positive to about 5%. And that was one of the indicators. And at the moment in Wokingham, we're about 2.5%. So, we're well below that. So that was one. And we get that data quite regularly, almost daily, actually. We get it daily now. The second one is monitoring cases over both a 7-day and a 14-day period. And that shows you the changes. And what Public Health England do is they do what's called exceedance reports. And they do scores on over the last 14 days, how far are we from what's expected in our area? So we get those. And the third, so there's positivity, there's the rates and how they're increasing. The third one is, if we look at a map, are they all in the same place? Are they all in the same street? Do they all work in the same place? And that's the third one. And we now do get that data. And I can put it on a map and I could tell if it was all in, for example, if all the cases were in Twyford, we would automatically do something about it. So that's the sort of data we get. And I think, and the last one, what was the last one? I can't remember the last point now. I think they're the main indications. Now, I know the last one is if we have community spread. It might not be related to a high-risk site. It might be community spread, and that's where monitoring 7 or 14 days will give you an indication. The other thing we get is age group. I will know if it's young people, old people, or if it's working age. In Leicester, one of the big issues they discovered was a lot of the cases were in the 20 to 40 age group, which was completely different than what they had before. Now, we know that it's mostly people in the older age group that are more likely to get it and more likely to die from it. If we suddenly change the age profile, so they're the indications. I think on page 21, what you've highlighted is the policy changed after we wrote this document. We will update it. You're absolutely right. It needs to be changed.
No, I just know my kids are going back into whole class bubbles, and I read that and thought, hang on a minute.
This was written before, so there will be a number of policy changes that will have to be updated during August, and there will be a new document by probably mid-August.
Is that likely to affect the action plan related to schools, or does the number of children in a bubble not really affect that?
It will slightly change, because if you've got a whole school bubble, what happens if you get a couple of positive cases? Do you close the school or not? So it will actually change some of the actions.
Okay, thank you.
And maybe if I can come back on that, Chair.
Can we move on to Jim now, Sarah?
No, sorry, I haven't had all my questions answered yet. Thanks, Pauline. So I haven't had all my questions answered yet, and Susan's just about to finish.
Susan, go first.
So in terms of the education side of things in schools, Sal will, if he was sitting here, he would say to you that absolutely he's working with the schools right now in terms of that. That's taking all his time in terms of the preparation for the term in September. What I'd like to do is though on the point about enforcement and enforcement in businesses, if I can just hand to Nigel Bailey and he can give some information about that.
Thanks. You.
Thanks, Susan.
Could you like to chip in there then, Nigel?
Yes, certainly. It's a discussion we've been having with businesses through the various town centre groups that we've been working with over the last week and a half or so. recognising it is a real struggle for many, and many are really concerned about how well they can enforce it themselves within their shops. So we're sort of doing a number of things to help them. One is a publicity campaign. There's a whole lot of posters going out tomorrow to them that's actually moved face coverings to the top of the agenda in terms of a single message that goes on front of each of those shops. Also recognising, and I think, and certainly one of the councillors on here tonight as well has been involved in that, is learning a bit from what the hospitality industry have been doing, how they've managed to deal with that, those incidents where they've refused to serve people, and picking up some of that best practice there and trying to share it with some of the other shopkeepers. At the end of the day, if anything, it is a police matter, unfortunately. And so it's more about us advising at the moment, but recognising that police will not be able to take action on every individual case. So what we're trying to do is just support them, work on that publicity campaign through posters, social media and press releases as well over the next week or so, and then monitor it through the town centre groups on a regular basis and see what else we can do to support them.
Because when we had the social distancing measures put in around the town centres, we did have some employees that were actually monitoring the town. Has that ended, or is that likely to continue?
That has ended. It was felt it wasn't needed, and they were very much there for information rather than enforcement.
Right.
We had some people from PPP out wandering, and they still are walking around the town. And those PPP people will actually provide that on-site support and advice to shopkeepers, and they are continuing to do their inspections and do their patrols as well.
Okay, thank you very much.
Can I move on now then to Jim?
Thank you, Pauline. Yeah, firstly, can you pass on my personal thanks to everyone involved, because there's been a lot of hard work during this coronavirus, and I think work's been excellent. You mentioned myriad of policies. That was almost make it up as you go along at some point, particularly with care homes. Now, care homes locally, the council took a decision which should be applauded to stop accepting without testing into the care homes, which was a brilliant decision. I believe that decision could have been made earlier if we'd have got the right data. There was difficulty in getting data from care homes. There was different variations in what data was required from care homes, so different interpretations, which made it difficult to establish exactly what was going on. Have those been solved now? Are we in a stable and consistent state across all of our care facilities? And there's two more, if I can add to that. Testing timescales. We're reliant on testing. What's the turnaround of testing? And once I know what it is it felt to be appropriate? And the last one is the local intelligence, I think, is really important. How are we going to communicate to residents in a way that says, if you believe there's a local outbreak, dial this number, in simple terms? Thank you.
Thank you. Meriden.
Yes, I think there's a lot of good points about care homes, and I know you've already been discussing care homes. And there's a lot of things that were unknown about the virus in the early stages, which is why the policies weren't correct for care homes, including they didn't know in the early stages that the symptoms in the frail elderly is different. They didn't know that in the early stages. They only knew that when they did some studies in London towards the end of April. That was one. You're right, we didn't have the correct information about care homes, and we were probably the first council, and we pushed for it to A, stop admissions to care homes without being tested, and B, to get information, and we've pushed very hard to get a lot more infection control nursing support into care homes. And I think now there's quite a significant infection control nursing workforce that's jointly commissioned now between the council and the CCG and BHFT. So that is quite a significant change from what we had before. And that team will not only support care homes, but they'll also support primary care, and they'll support a wide range of sites. So that has been formalised, which wasn't formalised before the pandemic. So there are a number of learning points that have come out of it. We now have the data we need on care homes on a daily basis. We set up the care homes task force, and before the data came through, they were ringing all the care homes every day, which is quite a big task to do. So in actual fact, we had all the information we needed from the care homes themselves. Are you okay with PPE? Have you got any symptomatic people? Are you okay with enough number of staff? We're asking all those questions on a daily basis. And we're actually in a very good position. We have hardly any cases in care homes now. If there's one, we're surprised. It is nowhere near what we had in the past. So I think we're in a very good position with care homes. We're now being very careful about potential visiting policy, opening that up, because obviously it's an important part of people's lives. Relatives and friends visiting, but also being able to go out of the care homes. So all of that is in train at the moment, working with our care homes. I think your other point was around communicating to residents. I think we've got there's a number of communications going out through social media, and we are encouraging the public to let us know, and we are getting quite a lot of calls through, certainly from schools. I mean, schools ring us regularly and say we've got someone with a case or someone symptomatic. Sometimes Public Health England know about it, sometimes they don't. So we're able to manage that very quickly. Now, of course, schools are going on holidays, but we're going to rely on that system when those schools go back in September. But as for the public, I mean, there's a question about what further communication we'd be sending out. I think earlier in the pandemic, there was a leaflet went out from members to every household. There's a question whether we need to do that again, or whether we rely on social media and all the other communication channels that are going out.
Meriden, there was another question on testing and the turnaround for testing.
Right. Okay. The turnaround for testing should normally be 48 hours. And we do know that a member of our staff had a child who was ill, arranged a home test, and he did it very quickly, easily on the day, and the test result was back within 48 hours. So that is the norm. We have, in care homes, they're all using the portal to do regular 28-day testing now for everybody, all staff and all residents. They're not finding it always easy to use. And I've just been notified of one care home where they didn't collect all the tests for staff, but they've arranged another date. So some of those not straightforward, but the norm is 48 hours.
Thank you very much.
Thank you. And once again, thank you for all you've done.
Thank you. Paul.
Thank you, Chairman. And thank you, Meredith, for your detailed information. It's really, really helpful. Most of my questions have already been asked, but I do have a couple. Just going back again on the examples of communications with the general public. Have you seen any really information fatigue? So people are now sort of ignoring what's coming out. And my second question is on page 49, it talks about rough sleepers and testing. And based on the assumptions that individuals are currently housed in hotels, my understanding is there's no rough sleepers now in hotels. They've been housed elsewhere. But are there any rough sleepers still on our streets, and how would they be treated? Thank you.
Thank you, Meriden.
I mean, Susan might want to help me on this one. I mean, my understanding is we don't have any rough sleepers on the street, and we've looked very carefully at every single one. And where we have people in high-risk sites, we can arrange to have them tested if we think. And, a particular local home that we've really pushed to get everyone tested is at Yeldall Manor, where they have people with substance misuse. And we're starting to get them tested. So sometimes it's a matter, if they're high risk, getting them tested before they have symptoms. Now, we do always have to remember that when you test somebody who hasn't got symptoms, the test is not as effective. It is potentially only 50%. So it doesn't tell you may definitely not have it, which is why staff in hospitals are getting tested regularly, not just once. But we do have that opportunity now to get people tested if we think they're high risk. And yes, I'm not aware of any that are out on the street at the moment.
That's correct.
I know we have worked very, very hard as a council on the homeless, so that's good to hear that confirmed.
I agree, and that's correct.
Susan, did you want to come in on that?
No, I would just really echo what Meriden has said and the point that you've made in terms of the work that's taken place with people, homeless people, and yes, there are.
I think there was one more question around communication fatigue.
Yeah.
That is correct, yeah.
Yes, that's a really interesting one, constantly finding new ways of talking to the public. I'm not aware of it. I've not heard that people are saying, no more, I don't want to hear anymore. And we do a lot of communication by the voluntary sector with our vulnerable people. And so in some ways, they're doing a lot of it for us. And the faith sector, the parish councils are all part of that group. So I think there's a lot of different routes for talking to people. And there's a lot of people are still scared and frightened and not sure about going out, not sure about socialising, not sure about going to work. So I think there's a lot of reassurance needed. So I don't think it's a matter of just, teaching people. I think it's a matter of listening and trying to reassure people and helping people through enormous numbers of policies and what people can and can't do.
Okay, thank you very much.
Thank you.
The next person is Rochelle, I beg your pardon, Rochelle.
Okay, I have a number of questions. You mentioned libraries. Are you having everybody sign into a library when they come in? And my question about that is, otherwise, how can you find out who they are if they don't take out any books? The next question is a little bit more detailed about parks, page 37. You talked about home sanitizing and hand washing. And there isn't such a thing in Dinton. There's no place to do that unless the CAF is open, and the CAF isn't always open. There are no one-ways and adequate access. There's a big problem going across the A329 bridge. At this point, you can't actually have any kind of social distancing. It's less than a meter wide. Is there something being done to actually increase the social distancing? Next, the old park and ride car park. Teenagers are hanging out there, and I don't know who is actually going and talking to them and making sure they do socially distance. And lastly, schools with limited space, how are they going to be doing social distancing? And very finally, is there any reliable antibody testing? And have I actually been lost completely off of this because everybody's picture is gone?
Thank you, Rochelle. Meriden.
I'll start with the last one first. The answer is we're not sure about antibody testing yet. So I don't think there is one that's 100% reliable. What they're doing in all the research is they're doing antibody testing over a period of months with individuals, particularly with health staff, to check how long the antibodies last if they've had it. So it's fine doing an antibody test saying you've had it, you've got antibodies, but what we don't know is if they've still got antibodies after 3 or 6 months. We don't know. That's the results of the test we're not sure about. The antibody tests themselves are reliable, and they're now being done in their thousands. I think the Berkshire Hospital Trust staff have all been tested, and they're being tested multiple times. Schools with limited space, yes, that's an issue. I think school colleagues are working through that with schools at the moment. I'm not sure there's an easy answer to that one. We do know there's a lot of places in society, and I think you mentioned the bridge, where you can't do social distancing, and the messages to the public are, if you're in those spaces, wear face coverings and either turn the other way from somebody, don't face them. You just have to remember, if you're in those spaces, you can only transmit the virus if you're within 2 meters for at least 15 minutes. and it's normally talking to somebody. So if you're wearing a face covering and you look the other way, which I know is not very friendly, then that's the way to avoid the virus. So there are ways of avoiding it if you have to be within 2 meters. And I know a number of shops can't manage that either. And I think that's all covered in the guidance. So I don't know whether libraries and sign-in, I'm afraid I can't remember that on that policy. I don't know whether Susan can remember or Nigel. I actually can't remember. I suspect it's good practice that for everybody. Nick's there. Nick can answer that one.
Hi, good evening, everyone.
Yes.
Yeah, the current guidance. I'm sorry, Nick Austin, Assistant Director for Customer Localities. The current guidance is to sign in at libraries. So the plans that we're working up in terms of reopening and the risk assessment will evolve a sign in if you have to enter.
Okay, thank you. Abdul.
Wait a second, I hadn't finished completely. I hadn't my questions about the parks, about at Dinton. Also, the old park and ride with teenagers hanging out that no one seems to be talking to them and telling them perhaps not doing that. And the adequate access across the A through 29, there's a possibility of opening up the other side of the bridge. Is the borough looking into that at all? I know that Paul and I and Prue were looking into this and they were talking about it, but we'd like to have some other access available so we can actually go one way across the bridge and be safer as far as this goes. And that's in general, but where are we doing? You keep saying there's hand washing and hand sanitizing at Dinton. Not during lockdown, there wasn't. There was no place to do anything like that. How are we going to do that? And also, how are you going to disinfect the benches? I have no idea how.
I thought you'd finished.
No. Okay.
Susan?
I was going to ask Nick. Nick, would you? I know that. Would you know the answer to these questions? If we don't know the specifics, what I would suggest is that I get the answer from the officers that oversee the parks, and then we can write you a detailed question. So
that would be fine.
Yeah. Okay. Let's do that then. Nick may know, but let's find out.
Right. Thank you. Right now, Abdul.
Thank you, Chairman. Good evening, all. I have two questions. One is, can you share with us the lesson learned from the Leicester BME group, what we can do here in West Berkshire? First question. The second one, when we enter mosque, we have about 20 plus mosque in Berkshire West, one in Workingham. When we enter mosque, whether it's Friday gathering or individual gathering, we do not take any telephone number or people who's come to praise their information due to data protection. I wonder if you could please give us more detail how you can trace in case something goes wrong. Thank you. Did you hear me, Chairman?
Meriden, are you there?
Yes,
I am.
Yes, I can definitely help with some of this.
Okay, thank you.
Leicester had a lot of learning around the black and minority ethnic communities because it affected them more than other communities. I think it's similar to what you're talking about. They were actually talking to the mosques about how they do social distancing, but it was also about how they identify risk assessment, not only the community, but also staff in hospital. They were doing a lot more risk assessments of staff and moving staff away from COVID wards, that kind of thing. And they were also talking to the community about reducing the size of gatherings, that type of thing. But as for the mosques themselves, it depends. If you can do social distancing, then possibly you don't need to collect names because you're only at risk if you're within 2 meters for at least 15 minutes and you're talking to people. If you're staggering people entering a mosque and you're sitting 2 meters apart, then you're not at risk. But we have bypassed the data protection laws for pubs and clubs and all kinds of other facilities where they do take names. and it's collected only for the purposes of passing on to NHS Test and Trace. So there are ways of doing that if you felt that there was a risk.
And Chair, if I can say that I think that when we originally talked about bringing the control plan to the Overview and Scrutiny Management Committee, it was about helping us actually, bring in the thoughts that we needed to take account of as we move forward. So it wasn't only a reflection of the current plan; it's about how we can, take forward on the questions that are being asked. So I suppose in a very roundabout way, what I'm saying is this point about mosques is I think we really need to take back and think, okay, how can we address this? So and I think that's how we can use some of the questions and points that are being raised, because we're at the early stage of the plan. I think it's about taking those really useful points and questions and incorporate that thinking into our plan.
Thank you. If I can lighten the mood just for a second, you might like to take a visit to Costa coffee shop. They've got a pretty good process going. Anyway, Andy.
Hello, thank you. I just want to take you back to your answers to Sarah's question, and you were talking about the positivity rate. And I think I heard you say that the positivity rate was 2.5% in Wokingham, and that it had reached 5% in Leicester, and that was one of the warning signs, if you like. 2.5% to me seems quite high. Now, is that what it is in Wokingham, or did I mishear you?
That's correct. But if you look at the numbers, we've got less than 2 a day, whereas they were looking at, and so, we'd be lucky to have 5 cases a week at the moment, whereas Leicester had hundreds. So it's a slight difference.
You said,
and yes, I did say 2.5%. That was correct.
So does that mean 2.5% of people who are tested are positive?
Yes.
Because, whereas in Leicester it was 5% of people who are tested are positive. And at what point would it be alarming in Wokingham then? Because it just seems to be they're very close. We've been under the impression, I think, that the rate in Wokingham is much, much lower than that in terms of, say, 1 or 2 per thousand. Was that the incidence rate?
It changes. Yes, we are. Our rate of cases per 100,000, we're still around the 340 rate, whereas the England average is around 454. So we are well below the England average. And Leicester is over 1,000 per 100,000. So that's the difference. So we are well off those numbers. Our numbers are very small. So I think, the ranges of positivity tends to be sort of maybe 0.6 to about 5 or 6. That tends to be about the range. So yes, it may seem, that's only one indicator, don't forget. You've got to look at that as well as the 14-day rates and the 7-day rates, and plus the ages and everything else. It's only one factor.
Okay, thank you.
Okay, thank you very much. And the last question is from Paul again. Go ahead, Paul.
Thank you, Pauline. In many instances on section 14, it states the information will be provided to borough councillors. So what is our role as councillors in that instance?
Meriden or Susan?
Sorry, just remind me of the first part of that question. You said
So in many instances in section 14, it states the information will be provided to borough councillors. So what's our role as councillors in that instance?
I think councillors have a number of roles. One is in helping to reinforce the messages with the public and the people you're in contact with, because a big role that we have is in socialising the message so people can continue doing social distancing and continue doing the right thing as far as possible. But I think secondly, have a role in helping us to identify there might be a potential outbreak. You might learn about a business, or you might have heard about the Tesco cases before the press. and to let us know. And that could be one route of us finding out about something we didn't know about.
Okay, Paul?
Yeah, will there be some guidance sent to all councillors?
That's a good point. I hadn't really thought about guidance. We could think about that.
Yeah, we can. We can maybe think about some key pointers that we can send out. Because again, like I said, this outbreak plan is evolving. It's developing. So absolutely, we can do that. I think it's a a good point.
Thank you.
Right, thank you very much. Can I say a huge big thank you to Susan and particularly to Meriden. Meriden, the depth and breadth of your knowledge is absolutely astounding. So thank you very much indeed for sharing it with us. It's been incredibly useful. And thank you for coming along and spending so much time with us. And really lovely to have you. And you've given us so much information. Thank you very much indeed. Thank you.
Yes,
right, and now then, we turn to the next agenda item, which is travellers. There's two documents. There's the guidance and process, and then the unauthorised encampments over the last 2 years, data about that. Now, we've got over a dozen questions, and I've already got a note of the people that would like to ask them. So, without more ado, can I ask Jim if he would like to ask his first question, please?
Thank you, Chair. The question is, how do we help and support our residents and travellers on the issue of encampments? There appears to be very little online information support from Wokingham, but other councils, and I have some examples if needed, have quite large parts of information and support offered to their residents.
Right, now we've got three officers, and I don't mind who answers that question. Nicholas or Sarah? Sarah?
Hi. Yep. Hello. Hi there. Can you hear me?
I hear you. That's
Great
fine.
stuff.
Go ahead.
Hi. So, hi. I should probably say a little bit about this report very briefly. So, my name's Sarah. I'm the senior specialist housing manager under Simon Price. So, with regards to this document, it's addressing various areas around unauthorised encampments, including some statistics, some data, some preventative measures in terms of physical target hardening, as well as potential legal measures we can take. It covers welfare issues, it covers communication with members of the public, with private landlords, officers of the local authority. It covers meeting the needs of the GRT, that's Gypsy Roma Traveller Community in the future, and talks a little bit also about some of the more vulnerable sites within the borough that may need some action taken. So yeah, we wanted to demonstrate the work that officers are doing to remedy the issue of unauthorised encampments within the borough. So Jim, in answer to your question around what are we doing to publicise the offering that we have at the council, what we do have as part of that one of the appendices, there is a public information leaflet which has been produced. So I'm hoping that you've had time to scan over that. That will, with members' approval, if everybody, it's open to comments. If you want to make any comments on it and get back to me, that's great. I'd really appreciate that. And then that will be going on the website by the end of this month. So on that leaflet, we talk a little bit about what the powers of the council are, what we can actually do if there is an authorised encampment. The leaflet is designed to also be helpful to private landlords and to be informative to them as to the actions that they can take and officers always support private landlords if they need their hand to be held through the process, because it can be quite a shock for people to turn up on someone's land. So that's what the officers do. They're very happy to help people through that process. And also we will be looking to update the website so that if somebody wants to report an incident on unauthorised encampment, it will be under report this in the council. So, if you have on there, you have report ASB, antisocial behaviour, for example, other issues. So we're planning to add report an encampment on there too.
Thank you. Paul, I believe you might have a follow-up question to that, and then I'll come back to you, Jim.
Follow-up, sorry, if I can. Yeah, the leaflet is a good start. It'd be good to understand when that online service will be there. If you compare with, as I say, there's a whole number of different councils. Salford are just one that I picked up this afternoon. They have a menu of help items that can help with information about how private landlords and people that want to report, the whole thing is there, what councils can and cannot do. It sets out the situation of what's feasible and what's not feasible in those circumstances. But the key is that it gives them an easy way to report. And I don't think we've got that at the moment. If I search on the Wokingham website, and there is a recent report to Scrut Gypsies and Travellers, and it's basically a one-off report. This doesn't give you any information about how to do, what to do. And I think that would be very useful if we can get that in quickly.
Would it be useful, Sarah and Nick, if Jim were to send you some details about which authorities have got some good information? And I'm sure that they won't mind if we copy it.
Yes,
I'll do that then, Jim. That would be great.
Councillor, I'm happy to do that. I can confirm we've already reviewed a large number of them. If you think Salford is a particularly good one, and we're in the process of drawing up draft wireframes, so you will see it change quickly.
Brilliant, thank you.
It was more from the fact that it's quite easy to find a number of councils that make an offer of a service. At the moment, our service seems to be triggered by if somebody rings the police.
Okay, thank you. Can I bring Paul in at this point? Then I'll come back to you in a moment, Jim.
Thank you, Pauline. It's suggested that a bund is recommended as a solution, and a developer submitted a planning application as a particular location where there had been unauthorised encampments, but this was rejected by the planning authority as being too steep. But your example photo shows it considerably steeper than what they submitted. How can this be taken forward?
Sarah?
I'm wondering whether Nick or Nigel may want to take this
Apologies,
one.
councillors, I don't know if you can hear me. I'm having a bit of an IT meltdown. Yeah, councillor, if you can give me the actual details of that one. We have reinstated, we have two levels of group, a strategic GRT group and an operational level. And those are exactly the kind of issues where we need to make sure the whole council is working together to tackle it. So if you can offline give me that particular instance, but I will take it up and we'll see if we can progress it, because we don't want to be recommending one thing and then another part of the council saying no, it's not suitable.
Of course.
Thank you. I'll do that offline.
Thank you very much.
Back to Jim then. Your next question.
Sorry guys, it's me again. Statistics. In some of the documentation we've been sent, there are inconsistencies with some of the timings allowed or shown against individual cases. For example, Early Relief Road shows no time allocated by an officer, and a Reading University 3-day encampment shows 25 hours worth of officer engagement. There's a big variation between that, and the total spend of time, according to the reports, is 155 hours anyway. So that's a huge percentage against a 3-day encampment. And on the statistics, if you come down to the costings shown, the average officer time shown, I know it's not all officer time, is about 5 hours per encampment. Some of the work you have to do with the reports, the photographs, the capturing of evidence, the writing up, the liaison, and the social care of the travellers themselves, I find it hard to believe you can do all of that in 5 hours. I'm sorry, so I think there might be an issue with some of the statistics.
So I think, Councillor, I'll take that one, Sarah. I think you're right. It's an internal document. I think it highlights that we haven't got a robust capturing system for capturing the amount of time that we've been spent on them up to now. There is a variation in some sites, we become aware of and they're actually gone before any action's done, and some where they're behaving in a very antisocial way are more time consuming. But I completely accept those numbers look very low to me, and we will be working back through them. So apologies if it's an error. I think there is clearly underreporting, and I wouldn't say that the veracity of the data, all of those, but it clearly points to me that we need to routinely capture it. It's also not capturing everybody that's involved in a standard way. So we will rework it and we will make sure we capture it properly going forward.
And Nick, a bit like we did with fly tipping, I'm more than happy to help with that if it helps.
No, absolutely, Councillor. No, and as I say, it's an internal document. I don't think it's nowhere near final, but it does highlight to us we aren't recording. But there is, just so you are aware, there is significant variation between some locations and some of the individuals were involved. But I do accept that shows to me significant underreporting, and it doesn't show anywhere near the full cost. So it will be reworked.
Okay, thank you.
Thank you, Jim. Right, carry on.
I was off again. COVID has resulted in some changes for how we manage traveller encampments with the Mere Oak 10 vehicle site. I'd like to understand how that has gone, how it's been managed, and is it something we should be looking at going forward?
Is that Nigel?
I'll pick this up, Chair. Thank you. Yes, the Mere Oak site, as some of you may know, was what's called a tolerated stopping site. So under the new COVID legislation, we were able to put in place what's called a tolerated stopping site, where basically we could ensure that actually we had a location where we could move travellers onto without actually expecting them to move out of the borough. It's worked very effectively in partnership with Reading Borough Council. It's been a joint site between ourselves and Reading Borough Council on their land at Mere Oak. We have had a couple of occasions where we've gone over the 10 spaces, but the travellers have actually moved on when they've been asked to. We provide the water, we provide the facilities that they need as a tolerated site. They also sign up to that tolerated site, they keep it, they don't cause any problems, etc., etc. So it's more of a negotiated approach on that tolerated site. It is still there at the moment. We're in discussions with Reading Borough Council as to how long they allow us to continue using the land. But that sort of tolerated stopping site sort of flows into the discussions potentially around a negotiated stopping site approach that we might want to look at going forward when we're looking at that balance between that and maybe a transit site, a more formal transit site, as which is the most appropriate option for Wokingham going forward.
That negotiated is the reason for asking the question, Nigel, because I think it's an option that other councils have looked at.
Yeah, absolutely. And I think it's something we need to look at. It's not like you have a single site for a negotiated site. It's not like you have a single site. The intention is that you would have a number of sites dotted around the borough that could be done for a short period of time. But it does work in some local authorities, and it's a bit of work we are starting to do now to understand whether it may be more appropriate for Wokingham rather than a permanent transit site.
All right, thank you. Any idea as to when that work may be finished? The only reason I asked that is that the government started their consultation on travellers' sites in 2017, and we still haven't had the results.
I can't give you an answer to when it will be finished, but we are working on it at the moment. I will assure you, Jim. We'll let you know as soon as we can. We can certainly give an update back to the.
Jim, have you still got some more questions?
No, Paul, I cut mine down. I have a number of things I'd still like to talk about, but other people had questions as well.
That was all, was it? Thank you very much. And now moving to Andrew, who's got, I think, 4 questions.
No, just 2 questions, if I may. I know that WBC has a very good relationship with a lot of private landowners, but my first question is, what powers does WBC have over private landowners who are not interested in preventing encroachment or on assisting to move encampments on? The second question is very different. I note that WBC must make inquiries about children's education. Is it possible to adequately monitor school attendance of children in encampments? And who's responsible for this monitoring? And an associated question, is there an effective monitoring of other vulnerable groups, such as adults with learning or other disabilities and vulnerable elderly people living in encampments? Thank you.
Right, there might be several different officers that want to answer those. So who's going to go first? Nigel?
It's probably not me, actually. It's probably more relevant, actually, in terms of the... We do have systems in place, and just if I can pick up just the issue around the welfare checks, we do have liaison in place with colleagues across children's services, but also from our own team as well, who will do the welfare checks. We'll pick up issues both from children's into schools, their own welfare, any safeguarding issues, and report those back. And that's both for the permanent sites, but also for any encampments as well.
Yeah, so within the housing team there and localities team, there is any officer that goes out will do welfare checks, as well as the officers within children's. So those are how those issues are picked up.
And Nick, have you got anything to add? Nick, anything to add? No? Okay. Anything more from you, Andrew?
Yes, and the first question about private landowners who are not not wishing to assist with moving encampments on, or to stop encampments.
Sarah?
Yes, so what we're hoping to do is to, within the Community Safety Partnership team, to forge better links with other local authorities to understand how they are also dealing with the same issues that we face. I think that it can sometimes be difficult if private landlords show not much interest in moving encampments on. We did have one encampment recently in the past year or so, past couple of years, where they were on site for quite some time. So the private landlord wasn't interested in moving them, but the main issue was that the encampment was causing absolutely no antisocial behaviour, and there weren't more than the number of caravans that needed to be moved on. So that was a bit of a tricky one. But usually, if there are issues in terms of antisocial behaviour or too many caravans on site, there are actions that the police can take. So we would then enforce that along with them, and we can use our own bailiffs to remove encampments.
Jim, I've seen your hand up. Is it on this issue, or shall I add you on at the end?
On this issue, if I can. Sarah just mentioned there about liaison with the other local councils about how we approach this. Susan, I know you've been busy with other things, but I think you had an action from a couple of meetings ago to actually talk to our neighbouring councils on this topic. Did that happen, or did COVID get in the way?
I think that on that, I think I'd probably like to ask Simon, because I think Simon was at the same meeting, and I mean, certainly from my perspective, that COVID has obviously that's been a priority. But my expectation is that when we've come to this meeting, that we are seeking good practice, looking at good practice from other authorities. And I know that Simon, I think it was Simon that was at that meeting. So what I need to do is go back to Simon and ask Simon about that.
I know that one of our officers is working on that at present, so that is part of her project. So she is making those links and put it in, sharing best practice and forging new working relationships. So that's what she's doing.
Can I just say as well,
just in case there was something that came across there.
Can I just say as well, I, with the community safety manager, have got a meeting in the diary with the inspector responsible for unauthorised encampments across TVP, with a wide variety of experience and working across other authorities. So that is already a piece of work that's in progress that we'll report back on, because we're very keen to make sure we adopt the best practice and improve our working relationship with the police.
Because I guess what I'd like to say is a general principle that, you know, for me it's important to step up enforcement where appropriate, and I'm talking about across the board in regards to different issues. And that's why, for example, I mean, you mentioned about our action with regards to fly tipping, and I was keen that we have a strong policy with regards to that and with regards to enforcement. So, and the same principle applies with this as well. And for me, it's really important that we learn from other authorities, but it's not necessarily I'm going to do that as well. All that.
And I think this issue is one which is more than just enforcement. I think it's when we talked about negotiated stopping and things like that, it's finding a solution. It means we don't have to enforce.
Yeah.
Whilst I've still got the microphone, just thank you to all the officers that deal with this, because I understand and I've dealt with it. It's a difficult topic. Thank you.
Thank you. Sarah, I wonder whether you'd kindly coordinate the work that's going on and perhaps send the results to Neil Carr, who can then send them on to the Overview and Scrutiny Management Committee, because I think we'd all be interested in what results you find.
Yeah, we can certainly provide a progress update in the future. That's no problem.
That would be really helpful. Thank you very much.
You're welcome.
And now, Sarah Kerr.
Thank you. I've got a couple of questions, so a point and a question. Firstly, with regards to transit sites, I did speak with Simon about this because the Chestnut Avenue one that's mentioned in the report, that's actually my ward. So I was getting a lot of phone calls from people about this. So I had a few conversations, and I'm really pleased that transit site was put in for COVID. I think this is something I think we should be exploring a lot further as a local authority for a more permanent solution in this regard. And as such, I would like to see a business case on this and maybe request that something like this can come to Overview and Scrutiny for us to look at and scrutinise, to firstly check that it is the right thing and that it's done in the right way and that it's going to work. So if I could request that, please, and I hope that's okay, Pauline. My second part is related to the Chestnut Avenue site, and I saw in the report, I know that things were slightly different with COVID and we didn't want to move people on unnecessarily. The issue with that particular site is the antisocial behaviour levels were really bad. And I mean, on day one of my residents was hospitalised from a dog attack. And I'm surprised that it took so long for them to be moved on. And I know that members of the public actually got in touch with John Redwood in the end to try and get action. It was felt that action wasn't swift enough given the level of antisocial behaviour that was happening. Could I ask a little bit more about actually what happened? And the other aspect of this, I felt as a local ward member, I was promised updates all the time. They didn't really materialise very often. I felt that the communication wasn't as good as it normally has been in the past. I'd just like to understand what happened and how I can reassure residents going forward.
Is that Sarah? Or one of you others? Nobody's confessing.
Yes, I wasn't close to that one. I don't know whether, Nick, you're able to update on that one.
Do your best, Nick.
You're on mute.
Yeah,
sorry, he's having problems.
I've been clicking around. Yeah, apologies, councillors. So with that particular site, It was the first one. Obviously, we did have COVID related guidance into terms of how quickly we would move on. Our normal process, if it had kicked in and we'd picked it up on the Monday morning, would have been we would have taken bailiff action on the Wednesday. And by the time we took action, it was the Friday morning. We were in conversation with the police about the levels of antisocial behaviour and whether they would exercise their powers. Once we were clear, the threshold had been crossed that took over, we took action and resealed the site. I do appreciate we've carried out a post-incident review, which is our way of getting all the people around there. We realised there was a bit of, because we were in the middle of, we were also trying to decide whether this particular family could be considered for a transit site, because even if they're in a transit site, they still have to sign to say that they will behave in a certain way and sign up to a code of conduct. That was in the process of being organised in general. Once we realised that we hadn't done it past, but there was, and I will accept that where there was a little bit of, while we were still trying to work things out, I think the communication in the middle and about the Wednesday did dry up, so we would apologise for that. We normally, our standard process is that you would get, and I think you see routinely, the emails that would come out of Dina's team giving an update daily. I think it was just why we weren't clear about whether the police would or wouldn't take action and what our options were in terms of moving them on. So all I can do is apologise. We have learnt from that. That particular family had moved on and had been bouncing around the borough, and as I think was pointed out in our pre-meet, in terms of our numbers of encampments and the ASB associated with them are disproportionately affected by a single family, and that is what we're looking to pursue further legal options.
Okay, thank you.
Sarah, have you got anything else, or has that covered it?
That's it, thank you.
Thank you. And now Paul.
Thank you, Pauline. My first question is on page 36, meeting the future needs of the GRT community. The draft plan includes proposed site allocations capable of providing 24 pitches, but the previous report was talking about 26 to 90 pitches are required, which is quite a range. How will the future need requirement be established? That's my first question. My second question is about the need for a transit site comprising 5 pitches. How would this be managed? And particularly if there's 2 families wanting to go there at the same time. On page 38 and 39, you talk about in 2019 a named family illegally camped in the borough on 29 occasions between February and September. And in the financial year 2019 to 2020, there were 27 occasions. Therefore, the majority of the unauthorised encampments in 2019-2020, did they come from one family? And on pages 38 and 41, you talk about unauthorised encampments and injunctions, but what level of consistent unauthorised encampments needs to be reached by one family to trigger an injunction such as Basingstoke and Deed have introduced? Thank you.
Who's going to answer that?
If I pick up the first one about the needs side of it, perhaps, the 2017 Gypsy Traveller Accommodation Assessment was what we based the figures from in terms of the local plan update moving forward. It is a bit confusing because the definition changed through the planning policy of traveller sites in 2015. And it took out of that group those travellers who were no longer travelling permanently. So you end up with a mixture between those that are called PPTS, which is the planning policy traveller sites, and those that are cultural, who don't want to live in bricks and mortar homes. So that's the 26 to 90. The 26 is that PPTS base number. The 90 includes those that we consider to be the wider overall cultural need, and that's what the plan itself is aiming to meet across the like of the plan. To recognise it's not just about PPTS. We have there is a requirement across the broader cultural GRT community. And so that's the plan. That was what the plan will start to try and move towards. And you'll see the number for those initial 24. And then they also comment that we expect to see the others picked up through opportunities that will come up over the lifetime of the borough plan, which obviously moves to 36. So, but we'll continue to look at that 5-year housing land supply for GRT as well, to make sure those ones are coming through as appropriate to meet those needs as they come to us.
Okay, Paul, some more questions?
I think that was
I haven't got answers to the others yet.
Right. Has anybody else got anything to say on this item? I think we've well covered the questions and a lot of information.
There was,
yes,
there was the second part about the injunction.
Five pitches.
Yes.
Go on that first.
Sorry, I'll just pick up the 5 pitches, and then Nick can pick up the bit about the injunction side of it. Yes, the 5 pitches, which is 10 pitches, base 5 pitches of which each can cope with 2 caravans. That was based on an understanding at the time of where we thought the unauthorised encampments in terms of number of caravans in the borough were during a certain period. And it was felt that 10 caravan locations and 10 caravan pitches would be sufficient to meet that need. And so if we produce a transit site that has those 5 pitches, each for 2 caravans, our understanding is that that should meet the need of that transit community. Transit sites are very much there for people to stay, usually for 3 months maximum. So there is a turnover on those transit sites as well. It will be managed, if it's one of our own sites, it will be managed through the team that managed at the moment has been managed the tolerated stopping site. Because it obviously has a lot of similarities between a tolerated stopping site and a transit site. They are very similar in terms of how they're managed.
So for example, if a particular family want to go to that particular site, they approach the council, if it's a council site, to get their slot. Is that how it works?
Without knowing the ins and outs of it, that's how it works elsewhere, and I'm assuming we'd work a similar approach here, yes.
Okay, okay.
Okay.
I don't know whether Nick wants to cover the other part.
Well, and just in terms of the injunction, I think the initial inquiries council were whether we could have a unnamed borough-wide injunction just against travellers, and there's been a series of recent case law. We recently obtained updated advice from an external counsel about what we need to take action against a named family, and as you're right, as I said just previously, the majority of our incidents of unauthorised encampments and the vast majority of our antisocial behaviour associated with them does seem to be arising from one named family or one named family group. We have an action plan based on the council's advice to get the information we require together, which is being actively worked on, and we will want to get that to a stage where we can take a decision whether we can take that to court. The issue is not just their presence, and I think the previous question about what powers have we got if a private landowner has them on their land and refuses to do anything, powers don't kick in until they're causing a problem. I would say that the threshold would be significant. I would think, from what I've seen, we must have passed that threshold. It's just a question of getting it together in a way that we can document with the support of the police, so that we'll be in a position to move forward with getting an injunction.
Yes, and it is quite time consuming to get all that information together. So officers are following it's document D, which you'll find there, and that is the legal advice which has been put into Excel format, so to make it easier for officers to go through and collate this information in order to try and get this named injunction.
Okay, so there's actual trigger point in there, is there, in that particular document?
It states the things that we should be looking for. So if you look at document D, you'll be able to see objective, if there's poor hygiene on site, to gain evidence of that, if there's damage to playgrounds, etc.
I don't want to interrupt, but I'm interrupting.
Yeah, carry on, Andy. Andy, what did you want to say? Andy? Andy, can't hear you.
I came into this discussion having been in a pre-meeting where we discussed some of these issues, and my feeling is we've actually crossed a line. I may be wrong. If the officers are happy to continue,
I agree with you, Andy.
Yeah, I think the point about actually that trigger point is probably something we don't particularly want to have as a public domain. But obviously, is crucial to us in terms of taking forward any work that we're doing. There will be trigger points, as Sarah says, within which we'll obviously take when we go through the injunction process, but probably not appropriate to discuss those in detail now.
That's absolutely fine. I didn't want to get into detail. All I wanted to know was there is a trigger point there for you. But thank you.
That's Andy. Thank you. Jim, you finished now?
I just got my hand up to say that I have some experience in this area, and I just want to express my thanks to the officers who deal with this on a regular basis, because it is not an easy situation. So thank you, officers.
Thank you, Jim. And can I also add my thanks to Nigel, to Nick and to Sarah for giving up your time and coming to answer our questions. It was really, really useful. Thank you very much. Now, you may go if you wish.
Thank
you
you.
very
Bye.
much. Thanks. Bye-bye.
Thank you.
Bye.
All right, we now move on to item 19, which is the performance monitoring. If you'd like to make any comments, perhaps you could raise your hands. Nobody. Yes, Paul. Sarah.
I've only got one question on this. This is old data, so I don't think we really should be spending much time at all on it, because things are all going to change. But residents are becoming increasingly frustrated knowing that wet paper and card cannot be recycled. This council therefore must take some swift action to address this, and not expect residents to purchase lids, etc. So therefore, when will we see action from WBC to protect paper and card from getting wet? Thank you.
Susan, I don't know whether you would like to come in to answer that. Are you still there, Susan?
Yes, sorry. Yes. Yeah, so there is going to be action on that imminently. So, yeah, so absolutely, it's there will be.
Yeah, I can confirm there are discussions that have started on that. There are a number of options that are being considered.
Absolutely.
So I don't know what the outcome will be. Yeah,
that's right.
Right.
As long as we can be updated. So thank you, Chair.
Yeah, of course, yeah, absolutely, and yes.
Right, I've got Sarah, then Andy.
Thank you. I appreciate that a lot of these are going to change as we have a new strategy that we're working on. But I just wanted just to highlight that something I've mentioned several times before, and it's KPI CE1 and CE2, which is the revenue and capital budget monitoring forecasts. I don't know how these are going to be done going forward, but I'm still disappointed to see that any underspend is still classed as green in both these instances. Large underspends are not a good thing, and this should be taken into consideration in any RAG rating that we have on these going forward. So can I just say, for good financial management, can this be taken on board, please? I think it's the 4th time I've mentioned this now. Thank you.
Any answer to that from any officer? Louise.
Good evening. I'm Louise Griffin. I work in Communities Insight and Change. I'm here on behalf of Keely Clements, our director, who sends her apologies. Councillor, thank you for that feedback regarding the revenue and capital forecast. I will feed that back. I recall we were in discussions earlier in the year about reviewing that. I think in previous meetings there was some concern about us reporting it as red when there was underspend. However, yeah, completely take on board that feedback, and I will feed that back to the director to review for the future.
Thank you. Just to say, it's reported green for any underspend. That's the issue. Just want to clarify that. I mean, a small amount of underspend can be good, but big amounts of underspend are worrying, and they should be flagged as red. That's the point. Thank you.
Yeah, absolutely. Sorry. I think previously we did have different RAG ratings. So I think previously in the year, or perhaps pre-1920, if there was an underspend of a certain percentage, we used to report it as red and highlight it as an issue. But recently, as you mentioned, for 1920, we were reporting that as green if it was an underspend, but I'll feed that back to the director and we'll come back to you on the decisions going forward.
Thank you.
Thank you. Andy.
Thank you. Thank you. I just wanted to sort of go back a step to Paul's comment. I can't remember where, but I'm pretty sure I've heard Parry talking about taking something to the executive next week on these recycling lids. I think it might have been in the joint waste disposal meeting last week. I definitely heard him say something. It's also popped up in the climate emergency plan. So I'm pretty certain there'll be something in the executive very, very soon.
Yeah,
and I'm not expecting Susan to give away anything which isn't yet on the agenda. Some executive members do let things leak sometimes.
Susan, any comment?
That was more to Paul than to Susan.
Yeah. I think yes. I won't comment.
Thank you very much. So let's move to the recommendation then, which is to endorse the Council's Q4 year-end performance report for the period covering January to March 2019 to 20 performance. Can I just ask whether there was anybody against that? If you could raise your hand. And are there any abstentions? Then that recommendation is carried. So we move back to the agenda, the Overview and Scrutiny Work Programme 2020 to 21. Now there's a lot of stuff within this one. What we need to look at to start with, I think, is Annex B. And what we've got to focus on really is the key issues, bearing in mind that the officers are extremely busy at the moment. So can we all find Annex B? Overview and Scrutiny Work Programmes 20 to 21. It's on page 91. And on that page we've got a number of suggestions from Woking and Without Parish Council, Early Town Council, and from Sarah Kerr. Now if I could just make a few remarks before we look at it. There are a number of things I think that are already on our programme, and I think if I look at Sarah's, because she's actually there, number 2 I think is under some ongoing work that we're doing, and number 6, 8, bullet point 13 and bullet point 14 come under the climate emergency, which is already being scrutinised. The home to school transport strategy is already being explored, and I think an external consultant is working on that with the Children's Services Department. And I might suggest that the regeneration plans, it's perhaps a bit early to look at those. So having made those remarks, Sarah, can I ask you how much agreement you would have with that?
So just on the home to school transport policy that's been updated, yeah, it is being done, but it still needs to be scrutinised at some point. So that would be good that could go. And obviously that I'd recommend that to Children's Services. It's up to them, obviously, whether they take it or not. Yes, a lot of this does come under the climate emergency side of things. What was the other one I was going to mention? But there was something in there and it's just gone from me. I know that Neil's got his hand up. Does he want to talk for a moment just while I remind myself what I was going to say?
Okay. Let's have a look at the Woking and Without Parish Council suggestions then, and we'll come back to you, Sarah, when you've had a think.
Well, I was just saying Neil's got his hand up.
Oh, okay. Neil, carry on.
Just to say, Chairman, I think we've tried to sort of weave some of these suggestions into the Annex D, which is the proposal for 2021.
Yeah.
And I would also say that bearing in mind the work that we're doing on COVID-19, that may well take up the next couple of meetings, certainly. So it may be an idea to say we accept Annex D and then come back to it after we've done our COVID-19 report towards the end of the year, and then determine which of the other items we want to pursue for the remainder of the year.
Did you say Annex D?
Annex D is the suggested work programme for each committee.
Yeah, so I think it'd be a good idea to look at that first and then come back to B.
Well, I think members may wish just to consider Annex D, because we've tried to take in some of the other suggestions into that document.
I think
and then maybe just look to amend Annex D.
I think that is an excellent idea. Annex
page 99.
Which page? 99.
99.
99, yeah. Okay, we'll look at that. Just before we do, I've got Andy with a hand up, so any comment, Andy, and then we'll look at Annex D, then go back to Annex B.
My comments were in the sort of spirit of the earlier part of this discussion, and I'm very interested in, with the home to school transport. I appreciate Children's Services with the consultants are doing a review, but one of our functions in Scrutiny should be to help with the review rather than look at something once it's been decided. And I'm wondering if there is a role there for the Children's Services Committee to actually get involved at an early stage in that. And my second comment was on the that actually taken from the Woking Without Parish Council suggestions. The two suggestions on, I think, so I'm just bringing them up. Where are they?
Yeah.
Two suggestions.
We will come back to those, Andy. I take your points. We'll come back to those when we've looked at Annex D. Okay, and I take on board what you say, and we'll return to those thoughts. So I think they're very relevant. Andrew, you've got one comment before we have a closer look at Annex D?
Yes, thank you. It's in relation to scrutiny of the climate emergency, and I think that Neil and Andy may be able to shed some more light on this. I'm also part of the Task and Finish group and climate emergency, but our remit has been deliberately quite narrowed to focus particularly on carbon accounting. And what I'm suggesting here is that if you want to widen that, as would seem to be apparent in point 6 in Annex D for the OS&M forward programme, then I think that needs to be understood and clarified, because at the moment the Task and Finish group has a very, very focused, narrowly focused remit.
Any comments?
Yeah,
Andy?
I think in the Task and Finish group, I think we've got 9 action points, if that's the right word, and we've picked out 3 or 4 of them, which includes the focus on the carbon budget. So I think within the remit of the Task and Finish group there is that scope to go wide. I can't remember what the other action points are, but there's certainly plenty more there that we're not looking at all at the moment, just because we want to do a good job on the carbon budgeting.
Randy, you're on that Task and Finish group, aren't you? So
yes.
If you could take that idea back, that would be really helpful. Okay. Neil, you want to come in there?
Just to say that the aim is to bring the Climate Emergency Task and Finish Group report to this committee in September. And then the committee may want to decide what it wants to do with it, whether it wants to expand into other areas. If Alison's can comment on that.
Well, when we reduced the potential scope of the Task and Finish, that was from Neil put forward, terms of reference, so it had sort of 9 things, and that's when we brought it right down to give us a task that we could achieve, in 4 months. I think we have met, despite lockdown, it hasn't stopped that Task and Finish group. And we've always said that there may very well be the need for another Task and Finish group. because the plan is dynamic and ever changing, and so we have to continue to scrutinise that and make sure that it's doing its job, the job that we want it to do.
So, do you think Neil's suggestion is probably the right way forward, Alison?
Yeah. So when we present it in September, then all of us here, the committee, can decide if there's more aspects that we need to set up a new task and finish group for.
Yeah.
I mean, I would say everybody on it, the members, the 5 of us, have been really pleased. We thought it was very, very effective cross-party working. And as a result of some of our comments and our feedback to officers, they changed what they were doing. So it really is, important that we have that input sometimes, not just looking at things afterwards, but during the process.
Yeah, well, that is one of the purposes of scrutiny, isn't it? To make policy. I'm really pleased to hear that that's happening, especially the cross-party cooperation, which always works best. Sarah, you've got your hand up.
Yeah, so it was just to follow up on Andy's point as well about the home to school transport policy. The other thing I just wanted to add on that, not just about getting in early with that, but this also relates to the climate emergency plan as well, because we're talking about how we're getting kids to and from school, and the green measures associated with that are paramount. So I think there is a double interest in us looking at that and getting it right.
So in effect then, numbers 1 to 6 are already being covered then, aren't they, by the task and finish group, or if they're not currently, then they probably will be. So let's move to number 7, to scrutinise progress of the local plan update and the 5-year land supply. Does anybody want to comment on whether we should keep that on or not? I've got Sarah and Rochelle. Sarah?
So my hand hasn't been taken down.
Oh, okay. Rochelle?
There's actually no progress on it at all. Nothing has happened since COVID lockdown, pretty much. And we definitely need to be doing something about it, because as it stands right now, the present plan is completely non-tenable, according to the housing executive, because we can't actually do Graiseley without the £252 million. So therefore, we need to redesign the plan to meet the needs. But we also need to change some of the ideas based on the present realities of the economy and where houses should be put. So that's something that we do need to talk about in OSNMC.
I guess a lot of officers are working on what you've just talked about, Rochelle. Do you want to keep it on perhaps for a bit later in the year, when a bit more work has been done on it, hopefully?
Probably it would be good to do in September or October, because we need to, if nothing else, we need to light a fire under some people and get something happening on it. But all of this depends on whether we get a second wave of COVID and everything gets thrown into the long grass again for a while.
Yeah. Jim?
I just like back up that statement. I think we need to do this sooner rather than later. At the moment, we're exposed to potential speculative development. Not that there's much green space left in Shinfield, but hey, they're after the last few fields.
And any place else they can find.
Alison? Sorry, Alison, go ahead. Alison? Oh, you didn't want to speak. Jim,
no, I didn't have my hand up.
Oh, sorry.
I haven't got a hand.
Jim and I've got Andy. Jim.
No, sorry, I hadn't taken it down for last time.
Okay, Andy.
Thank you. I mean, I'm looking at those things and I'm thinking, what are the things we really need to be looking at? And after COVID and after the climate emergency, I'm struggling to see on that list, apart from the plan, which we can't do because it's only just broken, I'm struggling to see things there which have got the urgency with them.
Yeah.
And I'm wondering if we're missing something.
I will take a vote on this. I think
Say
I'll
again?
take a vote on this because there's obviously... Hello? I said I'll take a vote on this one, the local plan, because there seems to be a range of views here. So I'll go backwards through the starting with Oliver. Do you think we should keep the local plan on or not at the moment? Oliver?
I've lost my mute or unmute.
Okay, got it. Should we keep the local plan on, number 7, or not at the moment?
I don't think it's in a position for us to consider at the moment.
Okay.
So
Alison?
probably come off.
Alison?
No, I think we've got other priorities.
Rochelle?
We do need to have it on there because if we're not considering it and nothing's being done, welcome to having a new housing estate built on your doorstep or on the field that's across the street from you or any place else that they could possibly build. Because if our local plan is out of date and it's more than 5 years out of date now, developers can build pretty much wherever they want if they go.
I'm just asking you to vote, Rochelle.
Okay. Yes, please. Yes, please. We need to scrutinize it. And light a fire under them.
Andrew?
Yes, please.
Ken?
Yeah, I think if nothing's happening on it at the moment, then it should be off. Off?
On or off?
Yeah, off.
O-N, on.
No, off.
Off.
Yes.
Sorry. There's a bit breaking up there. Abdul? On or off? Abdul, can you put your mute on?
Yeah.
Or change it
Off,
please?
off.
Yeah.
Take it off. Yeah.
Not to do it.
Not to do
Did you
it.
vote not to do it?
Yes.
Sarah?
I would like to keep it on, please, for when it's appropriate to do it.
Okay, Emma?
I say off at the moment. I think there's more important things.
Thank you. Jim?
On. Most important thing to most residents, other than COVID.
Keep it on. Paul?
Needs to be retained. Keep it on.
Andy?
I'm going to agree with everybody. We need to keep it on, but we don't need to do it now. We need to do it when there's actually something to do.
Later in the year?
Yes. Yes.
Jenny? Jenny?
Sorry, I forgot to unmute. I think we need to keep it on, but do it later in the year because you mustn't forget it.
Okay. I think, Neil, perhaps you can confirm, but I think that's a majority for keeping it on.
Yes, that's right.
7 against 5. But we will do it quite a bit later in the year when things have settled down, hopefully, a little bit. Okay. Right. Looking at number 8, scrutinising the council's economic development strategy and the impact of the Thames Valley Berkshire Local Enterprise Partnership. We haven't looked at that before. Anybody got any views on whether we should do that? Bearing in mind we've got a lot of stuff on our agendas and the officers are extremely busy. Any comments? So can I just see whether anybody is in favour?
I did raise my hand, but
oh, sorry, Rochelle, I've just noticed it. Yeah,
I'm just wondering how all of the changes in the economy from COVID and combined with the changes in the economy that's going to happen after Brexit, how is this going to affect our strategy, our development strategy?
Yeah, Andy.
I think I asked for this to come on in the first place. I would like to keep it on. I don't think it's terribly important. It's not like pressing, but I do think we should look at it. As you said, we've never looked at it before, and they are capable of throwing around huge amounts of money, apparently for our benefit. So I would like to know what they're up to.
So, what would you say in response to what Rochelle just said?
I don't think she was talking about Brexit or something, wasn't she? For a change.
No. I was saying that we do need to do it, but not right now. But probably
Exactly.
closer to December when we see how much of a disaster Brexit's going to be.
I think it's independent of Brexit. I think we need to look at. I don't think it's anything to do with Brexit. I think we just need to see what they're doing.
Yeah. If we did look at it, Andy, when do you think would be a good time to do it?
Again, it's not pressing. It could be done at any time. I mean, I'm almost thinking if there's nothing else which is urgent or nothing else we can do, we should perhaps have a look at it for the next meeting just to get it out of the way.
Next year?
No, I said at the next meeting. Yeah.
Oh, next meeting.
The next meeting. Yeah.
January?
It's just the urgent things to me are things to do with the climate emergency and to do with COVID.
Yeah.
And once you've done those, we're sort of, there's a whole tier of stuff which looks the same.
Right. Shall we have a vote on that then? Emma, you've got your hand up. Emma?
Thank you, Madam Chairman. The thing is that everything is changing weekly, daily, etc. And I think it could be a complete waste of time bringing this up, which is going to be a very long subject. And my recommendation is let's leave it till January to see what happens, because anything could happen between now and December, and the same goes for anything, COVID, etc.
Is that a formal proposal then, Emma, that we look at it but in January?
That is a formal proposal if it's in agreement.
Okay,
I'll second it.
Super. So let's have a quick vote on that then to look at it in January. Jenny?
Rather than go through everybody again, it takes quite a while. Could we just have people just to sort of say if they're against or abstaining? It would just be quicker.
Well, if you could all turn your mutes off so we can just go through very quickly and you're ready to speak. Jenny?
Delay it till January.
Okay, Andy?
No, much earlier than January, please.
Paul?
Delay till January.
Jim?
Abstain.
Emma?
January.
Sarah?
January.
Abdul?
January.
Ken?
January.
Andrew?
January.
Rochelle?
January.
Alison?
January.
Oliver?
January.
I think that's a pretty clear result then, so we'll keep that one on to January. Then number 9, the Equalities Act, scrutinising our compliance with the statutory duties. Bearing in mind that we are very busy, anybody got any comments? Sarah?
Yeah, I think it was me that originally asked about this, and I actually think it's more relevant now than ever, given how different characteristics of people have been disproportionately affected by COVID. We've seen a lot about inequality in the media lately. I think we do need to have a review and actually look and see what's going on, and because it affects all areas of the council. I think it's a very important topic.
Any other comments? Andrew?
Yeah, I do agree with Sarah. I think that COVID has complicated this, added to the urgency, of this. I would ask one simple question though. When was the last time that this was formally scrutinised?
Neil, do you have an answer to that?
2017, Chairman.
Then I think that adds to the urgency even more so. Yeah, thank you.
Yes. Can I ask if anybody is against keeping this one on?
I'm concerned we're doing it too quickly. this is a very inward-looking suggestion. We're looking at the internal workings of the council, and although it's important, I'm not sure if that's the right flavour of things that we need to be doing at the moment. We need to be looking outwards to things which affect the residents. That's my main concern.
I assumed that it was about residents. Sarah, did this come from you originally?
Yeah, it's about both aspects. It's inwards and outwards. It's how we deal with protected characteristics in the community. And I mean, some of the things that have come up during COVID is actually how we're communicating with people that don't have internet access, just as an example. But we do need to look internally as well. I mean, there's that tribunal case of that dismissal of someone with a disability in the council, which is worrying. And just a reminder, this was actually something that was on last municipal year's agenda, and it's been carried forward. So this has actually been delayed by quite a few months already.
Rochelle, you've got your hand up.
Equality affects everybody in the borough, includes all of us and everybody else in the borough as well, to make sure that everybody is treated equally.
Yeah. Well, let's have a quick vote on whether or not we should keep this on and interpreting it in the wider sense, outside the borough.
Pauline,
as well. Yeah.
I mean, is this something that, you know, the three subcommittees should look at, equality within their own areas? And Andy Croy and I have already had some discussions about how we could look more closely in children's services, education, as well as children's services, at making sure that, you know, Black Lives Matter, as well as that every single person, you know, has equity of opportunity. And I would have thought that, you know, HOSC would have areas they could look at, as well as CNC.
Sarah, what do you think about that?
Well, I think it just shows that equality affects absolutely everything. I don't know the answer, because it would all need to come together. We don't want it to be siloed. I mean, I don't know if it's worth maybe having some kind of task and finish group that incorporates people from each of the subcommittees, including the management committee, that can look at it in that way. I don't know if that's the best method of doing it. But we need to make sure that while it looks at all the areas, it has that holistic view as well.
Well, we've got two suggestions on the table. Let's vote on each of them in turn. First of all, let's vote on whether we want to keep it on, and then we'll vote on whether it should be on the management committee or whether it should go to various other committees. So going backwards this time, Oliver, do you think we should keep this on or not?
I think we should keep it on, and I think it doesn't necessarily have to be management committee. I agree anyway that it all has to be pulled together by somebody eventually.
Alison, or put your mutes on so you can just.
Sorry. Yes, we need to certainly keep it on and discuss further how to, scrutinise it effectively.
Rochelle?
Yes, we need to keep it on.
Andrew?
Keep it on, but I'd like us to explore the possibility of a task and finish group on this.
Ken?
Was that Ken, you said?
Ken, keep it on?
Yeah, on, please.
Abdul?
Keep it on, please. Thank you.
Sarah?
Keep it on, please.
Emma?
Keep on, please.
Jim?
On.
Paul?
On.
And Andy?
On, and look at ways of doing it better.
So we'll keep it on. Now we'll.
You haven't. Excuse me. You haven't asked me yet.
Oh, I'm sorry, Alison.
No, Jenny. I want to keep it on, please.
You and you said yes.
No, I'm the last one to be asked, and you haven't done. But the answer is yes. Keep it on.
Yes.
I thought you were muted, Jenny.
After Oliver, and I thought I heard you say yes. Never mind.
Pauline, Alison, I'm Alison, and I said yes, but it's Jenny Cheng that's just picking you up.
Sorry, I don't understand.
Well, you started with Oliver, didn't you? He was first.
Yes.
And I was second.
Yes.
And Jenny Cheng was the very last person on the list, but you didn't get to ask Jenny.
Yes, I did ask Jenny. Jenny, do you want to say again what you voted?
Yes, I would like to keep it on, please.
Yep, thank you. And now we'll vote between whether, if you just say the management committee or other committees. Starting with Jenny.
Sorry, could we also consider a task and finish group as a third alternative, a third approach? Sorry for interrupting.
I know you said that, Andrew, but I honestly don't think we've got the officer resource to do that. I really don't, because we've already got 2 task and finish groups happening. So I'd like to veto that if you don't mind too much. Okay. So can we restrict it to the management committee or to the other committees? Starting with Jenny.
I'm sorry, I don't know.
Okay. So I will say that's abstain. Andy?
Other committees as appropriate.
Okay. Paul?
Same, other committees as appropriate.
Jim?
Other committees
Emma?
as appropriate.
I'm a bit like Jenny at the moment, a bit undecisive, but
okay. Abstaining is fine. Sarah?
I think management committee to give that holistic view.
Abdul?
Management committee.
Ken?
More suited to management committee.
Andrew?
Management committee.
Rochelle?
I'm sort of half going between corporate and community and management. I guess I'll go with management.
Okay. Alison?
Other committees.
And Oliver?
All of the other committees.
Yeah.
That's a good suggestion.
That's what I said in the first place.
Sorry, Alison, what did you say in the first place?
When I speak to suggest that actually, it's such a big equality, since we're talking about all of our residents, every business, every setting in the whole of Woking Borough, then, each of the 3 subcommittees have got quite enough to look at to make sure that we've got equality and equity.
So you think management committee, do you?
No, I definitely think other committees.
Okay.
But I don't think just one other committee, I think all of them.
Yes, I think that's the implication. Oliver?
I think I'm going to have to abstain. I'm not sure.
Okay. So, Neil, if you could just check, we've got 5 votes for the management committee and 4 for sending it to all of the other committees.
Yeah, that sounds right.
So the management committee will look at that one then. Thank you.
But all the other committees can look at it as well, as Alison said.
No, she didn't.
No, it was an
Stick to management.
Either or, Rochelle. So.
No, I lost, Rochelle.
Let's move on. Number 10, scrutinising Brexit. I personally think it's a little bit premature to be doing that, because we don't know what's happening at the moment. Anybody disagree with that? Okay, so we'll not do that one then.
How about in January, after it's happened?
Do you really think it'll be resolved by then, Rochelle? We can always
probably in about 10 years, but
Andy?
It's just that scrutiny of Brexit preparations is on the borough risk register as how we are mitigating the risk of a bad Brexit. So I do think, given that the audit committee think we're looking at it, we should perhaps be looking at it in advance of Brexit. Not in advance of Brexit, in advance of the deadline, the extension period. So that would be this year.
Is the audit committee looking at it?
No, they're not. The audit committee has examines a risk register, and on the risk register it says that we are looking. It says overview and scrutiny are looking at it.
Okay, Oliver.
I think this is something that we have to be clear what it is we're actually going to be looking at. I mean, you know, it could be a very broad subject. If we're just looking at how the council is prepared for the Brexit and what preparations they've made and so forth, then I think we should be looking at it now. But if we're looking at the after effects of Brexit, then that's a totally different subject altogether.
In the past, when we've looked at it, I think we've looked at the borough's preparations, and I think what it came down to in the end was that we're not a port, we're not an airport, but the main impact was going to be on staffing of social care. That seemed to be the main impact from memory. So it might actually be a fairly quick thing to look at how that side of things is going.
Would somebody like to make a formal proposal relating to number 10?
Yes, I would like.
Yeah, go on.
If it's okay, I would like to propose that we do keep it on, but we focus it very much on scrutinising the borough's preparations for Brexit.
I think that goes without saying. I think, but it's the timing is the issue. I think we need to be looking at it before. Oops.
Oh, absolutely. Yeah, absolutely.
Yeah. I think there's no question of us looking at the broader things which don't affect, and it's got to be about the things the borough can influence and the things the borough council might be expected to respond to.
Okay.
For example,
Are you seconding it, Andy?
I'm amending it. So I'm seconding it, but I'm adding. Let's do it sooner rather than later.
I would go along with what Andy has said.
Okay.
And so would I.
Yes.
Let's have a very quick vote then. Again, put on your microphones so that we can go through very quickly. So, for or against? Oliver?
For.
Alison?
For.
Rochelle?
For.
Andrew?
For.
Ken?
Abstain.
Abdul?
Abstain.
Sarah?
For.
Emma?
Abstain.
Jim?
For.
Paul?
For.
Andy?
For.
Jenny?
I think we should delay it.
Right. So that's the majority of people want to keep it on. Can I leave it up to Neil to have a look at our forward programme and see where he thinks it'll best fit? Bearing in mind we don't want to leave it too long, but we've got an awful lot coming up in the next couple of meetings. Is that okay?
That's fine, Chairman.
Neil? Can you do that?
Yeah, that's fine.
Brilliant. Okay. Number 11, the food waste collection. I thought we'd already dealt with that. Neil, did we?
I think we wanted to assess how it had gone because it was only introduced, wasn't it? Was it earlier this year?
April, I think.
No, it wasn't until the middle of
year
COVID.
before last. It was the year before
so
April last year.
Yes, which is why I think we were going to look at it, you know, in the spring, summer of this year, because then there'd been a whole year to look at the data and see how it was going. And because we didn't, you know, meet after January, we haven't looked at it.
Andy, then Emma.
This, I think, is one of the candidates for getting rid of or doing next year. At the end of the day, it's going to be how well are we collecting waste? Well, we can do that on a table of numbers. We're either collecting it or we're not collecting it. If we were to look at it, it would be a written report. But the idea of having officers here for half an hour, us asking questions for half an hour on something that could be just as well done in, you know, on a one-page spreadsheet, fills me with despair, to be honest. I think we should sack this one off.
Couldn't we just get it included in the KPIs?
That
would work.
That would be an easy solution.
I was thinking that.
That's a good
might
idea.
be the solution. I've got Emma and then Paul wanting to speak.
Okay, very briefly, as far as I'm concerned, it's working extremely well in Charvel. I've had no complaints and people are just happy with it.
Yep. Paul?
Yeah, I'd reiterate what Andy and Emma's just said. I think we should leave this one and maybe pop it in next year or something like that, but certainly drop it off the list for this year.
Okay. Right, well, let us drop that one off for this coming year then. The statistics are there if anybody wants them, so that they can easily ask the officers. So that'll save us a little bit of time. Council's policies and procedures relating to unauthorised. Well, we've done that one.
Can I just say something on that, please, Pauline?
Sure. Mm-hmm.
So, in what we've done tonight on that, I did ask that we get a business case come back on transit sites.
Yeah.
So I don't know if that should be tweaked to include that, maybe, because that's actually something we can progress and go forward.
We have scrutinised the policies and procedures, so in a sense, you just want a business case to be presented.
Yeah, that's what I asked, because I think we need to know if a transit site's going to work, and yeah, we need that business case. It's been identified as something that should work for us, and it'll give us the chance to scrutinise it before implementation.
So a report should be sufficient, with perhaps an officer there if we want to follow anything up.
I would hope so.
Yeah. Anybody against that? It shouldn't be a long item. Anybody disagree that we should have it on?
Madam Chairman, it's Emma here. I'm sorry to interrupt. The only thing I would say about this reporting issue is it's not just our officers who have to approach the company who are dealing with this. It's getting these things from the company, and I think we need to be a bit careful about how many reports we request.
Which company's dealing with traveller encampments?
Sorry, you're breaking up on my thing.
Sorry, who's speaking? Emma?
Yeah.
Which company is dealing with traveller encampments?
I thought they were talking. I thought Sarah was talking about waste.
No, we've done that one. We're now on 12.
I apologise. It's my microphone. Apologies.
Okay. We've just asked for a business case report to come back at some point. 13, 14, 15 and 16 we've already covered, I think. Or we will be covering 16 later in this agenda. So that's that dealt with. Let's go back to, what page is it now? The agenda item, the Annex B. Right, okay. Working without parish council. All of these are very parish pump, aren't they? Anybody got any views on any of those that the parish council's put forward? Paul?
On the Wokingham without parish council, the highway maintenance area is being picked up by community and corporate item 10. Yep. So that's in there. Parking management is also being picked up in a way within corporate and community.
Yep. Okay, so we can knock those two off then. Andy?
Yes, as I was going to say earlier, I think the comments on the pedestrian ones, I've lost the page now. There are a couple of comments on
page 91.
Let me just find it, sorry, Chair. Where is it? Come on, page 91. Sorry.
Page 91.
I've got it now. So I think the safe walking and the connected cycleways, those two in particular, I think obviously not from just the Wokingham without perspective, but from the whole borough's perspective. I'm really interested in looking at how we are not just going to make sure that everybody's got access to these routes, but how we encourage people to use them. So I think there's a really good piece of work in there.
So really bullet points 2 and 3 go together, don't they?
Yes, yeah. Yes, 3 and 4.
Yeah. Do you think maybe the community committee should do that? It's a bit
that would work.
Possibly,
That's a good idea.
And Andrew, you've got your hand up.
Yes,
My
thank you.
apologies, Chair, I'll take it down.
Yes, thank you. Could we please consider adding early town council suggestion that provision of youth services be added for scrutiny? I would imagine that would be best done by children's services. And then,
can I just interrupt you a second, Andrew? We're still talking about cycleways.
oh, sorry.
Okay, we'll come to you in a minute. Paul.
Thank you, Pauline. Yeah, the cycleways I think should be taken on by community and corporate. That's the sort of areas that we cover.
Right. Is anybody against sending that to community and corporate? Put your hand up if you are. Okay, so then we will ask them to take that on, as not just for Woking Without, but across the borough as a whole. Parking management, particularly in our case, this is very parish pump, isn't it? Do we want double yellow lines around the Greenwood Road shops? Wider issue is parking management. Any views, Andrew?
Yes, on page 101, CICOS have scrutiny of CPE. I'm wondering whether this could be expanded to include all related matters, including the PIN trial, the parking information notice trial, and also all processes relating to TROs. So that would, that would certainly cover the concerns of Wokingham Without and Early Town Council. But it's already down just as CPE under corporate.
Okay, it's a good suggestion, Paul.
Yeah, I would agree with Andrew what he's just said on that. It could be covered in corporate and community under item 13.
Yep. Okay, is everybody happy with that as a suggestion? Anybody against? Paul, your hand is still up. Have you just forgotten to put it down? Okay. Right, then we will send that to C&C, combining those two areas. So, looking at the early town council ones, health and social care, it's a bit broad, isn't it? I wonder exactly what they mean. Any ideas?
Wouldn't that go to Husk?
Well, I am an early town councillor, okay, and I think that the at the time that the town council produced this list, they weren't aware, of some of the scrutiny that has since been added to the works programme. So the only one that I would put in a strong plug for, additional one, would be youth services. Okay. And, if it was agreed to refer that for scrutiny, I imagine that the appropriate place would be children's services.
What specifically did they want to have looked at, though? That's a rather broad description.
It's what is the existing provision, and yeah, I mean, it's just basically what is the existing provision, and what and how effective is any provision. Okay. It may indeed be quite a short item.
Alison, have you got a view on that as to whether that would be worth taking to children's?
Well, we've got quite a lot of suggestions already that we're trying to cover, and of course, COVID being a large part of that. Well, yeah, I'm sure we'll manage to cover it. We might have to have an extra meeting.
It's really just finding out what we do already, isn't it? And perhaps having a discussion about future suggestions.
Well, I mean, I have talked to Carol about having sort of additional workshops kind of thing of an hour that is sort of more officers just coming to explain how they do things rather than us, grilling them on how they do things.
That would be a good idea.
And, certainly, I mean, I don't think any member could say they won't benefit from learning more. So, yeah, we'll be working on that.
Andrew, would that be okay if we had it as
I'd be very happy with that approach. Thank you.
Lovely. Andy? Andy Croy.
Yeah, I had my hand up just to say that there is a very widespread feeling that youth services have been cut, and I think a lot of the public response to that will be about where are the missing youth services. So I think a session which especially highlighted the difference between what we do on a statutory basis and what we're doing beyond statutory, because I think that's the bit which is of concern to people, but that bit is declining, or has declined.
That's a
so yes, a training session in effect would be good.
Yeah. Maybe Alison can take that comment back to Carol when she talks to her as a sort of training session. Super. Let's move on then to Councillor Sarah Kerr. Some of these we're already now looking at. Which of these, Sarah, would you see as priorities? Because we are getting a very, very full agenda. Although some of these are already coming under climate change, for example.
No, I mean, I put these in several months ago. Just one thing on the review of the library offer, talking to Mark Redfern the other day, that's coming up for 5 years old, and actually the library service offer, things have evolved, particularly with COVID, and there is the potential of a review of that anyway within the council in 2021. So I propose that is looked at, but next year, so that
next municipal year.
Yeah, next. I'm not sure exactly when he meant in 2021, so that might be worth discussing with him first. He just said 2021, but if that is going to happen, which I think it should do, and it sounds like it will, we should be looking at that from the start to make sure that we have a good service offering out there in this new climate. There are some others that I would love to get through on there, but I'm conscious of time and fitting everything in. There is one thing at some point, though, the council website. I'm sorry, it is atrocious. I struggle all the time to find anything on there, and I don't know what's being done about that, but we seriously need to have a review and an overhaul of that website.
Neil, who is in charge of the council website? Do you know?
I think it's Nick Spencer, so it probably comes under the new director Keeley, I would imagine, but I'm happy to find out and see if we can get something rolling on that idea.
It's certainly something that is worth our looking at, because we've had so many complaints about it even this evening. So looking at Sarah's list, the two things that you, Sarah, think are the priorities are the library service, which could be looked at later this year or maybe even at the beginning of the next municipal year.
Yeah, it depends on when it's going to be done, and the website. The other thing at some point that really needs to be looked at is what we're doing around air pollution, because it keeps getting lost with climate emergency, but it needs to have its own agenda quite desperately. Some of the measures for climate emergency actually could make air pollution worse. So we need to make sure that we're scrutinising the council's actions on those.
I would suggest that the Task and Finish group take that on board, because it is very much part of that context.
It's not climate emergency.
I'm pretty sure. Andy.
So I'm just saying, I'm pretty sure we had something on air pollution about 18 months ago, and we had people in. Is that, Neil, can you remind me, did we?
That's pre my time.
But that doesn't mean it hasn't been done.
No. But looking at what we have on our website about it, it's not good.
We're back to website again then, aren't we?
No, I don't mean about it. That's not a criticism of the website. That's a criticism of what we do on air pollution.
Right, Emma's got her hand up. Let's hear what Emma's got to say.
I absolutely agree with Sarah. We have to do something about our website. Even us as councillors, I think we struggle in some areas. So I think this is one priority we need to look at, especially if we're going to be discussing about environment and Brexit, etc. It's got to be made more simple for people to digest and find things.
Yeah. Well, let's just make a bit of business here. I think the library, could we postpone that to the municipal year 2021 to 22?
Yeah.
Because it is being looked at anyway, so that'll come up on next year's forward programme when that's considered. The website, I think a lot of people would support us looking at that. Should that be the main management committee? Any views, Emma and Oliver?
I agree. I think it should be, but I think it's something that has to be looked at PDQ, to be quite honest.
I agree. Management committee?
Community and corporate could use it, and then we'll look at it later.
Okay. Oliver?
Sorry, my hand was up on the air pollution, actually.
Okay, right. If we were to send the website to corporate, well, they've got so much work on, but if we were to send it to corporate, would anybody disagree with that? But if you think that it should remain with management committee, then disagree, and then we'll look at the management committee doing it. Anybody who was against it going to the corporate?
Chairman, I'm only thinking about what community and corporate have taken on additionally tonight, and I think they've got a very big agenda.
They have.
I just raise concern about the amount they've got on and how much they'll get through in the year.
So have we.
Any other views? Emma,
We've also
Oliver,
taken.
Andy. Emma?
Well, maybe it's just all we need to do is, first of all, we just need to speak to IT department, ask some simple questions, and take those first as responses, and then email everybody and say this is our idea, and then put it forward to everybody else to corporate or the management committee just to sort out. It just needs a very, very quick response from the IT department.
Yep.
How can we make it easier?
Andy?
Yeah, I agree. I think the website one should actually be very quick. Get somebody in. The website is terrible. How are you going to fix it? And then come back in 3 months' time when you fixed it. So on that basis, I think we should perhaps keep it with us just to stop burdening other people. And Alison is waving.
Oh, can you see me?
I can see you.
Yes, I can see you.
Okay, yeah, I have I feel like for many years said that we really should have, communications scrutiny item, and get Andrea and other people, the press office and other people who do the motorcycle in, to understand some of their thought processes, because it's often a mystery when you see the website and the way it's laid out, things are described.
Rochelle? But
we've got such a big programme, I don't know, but I have, said for many years we really need to look hard at the comms.
How many things can we look at? We're getting to the point where we're going to be stuffed full of everything so many times.
Yes, yeah.
That I realize corporate and community is very busy, but so are we. If we keep taking on more and more and more, are we going to actually complete any of this?
True.
Unless we want to go till 11:30 at night every meeting.
No, we're finishing at 10. I haven't eaten yet.
Well, if you're all in agreement, I'm happy to speak to the IT department and send a note to Pauline with their response.
Response about what, though, Emma?
Well, just asking the very simple question to start with. How can we make the website simpler for the general public to find things to do? Because I'm always getting moaned at by the parish council. Oh, we can never find the person to speak to. We can never find the department because of the idioms and God knows what. It's just a very simple question to ask them, and then see what they say.
Oliver, you got your hand up, then Jim, then Andy.
Yeah, so sorry, I've actually done that already. I've sat with the IT group on fly tipping, and also about some of the travellers in stuff that I'm trying to get sorted, hopefully. They have a programme of improvements. It's taken them a long time. They were due to get a number of improvements in by next month. Unfortunately, COVID got in the way. I've already got that relationship with them. I'm more than happy to try and ask. I think we should ask them to come and present their forward plan of improvements, because some of that is all about making it simpler and making it easier. They actually have a programme of work to do. It's just that they're very, very slow in getting it done.
Oliver, and then Jim.
Andy.
And Andy. So, Oliver, did you want to speak?
Well, yes. I think the first thing is to actually ask them what the plans are, because we shouldn't be redesigning the website. That's not up to us. We want to know what they're going to do to make it more user friendly. Okay. So their forward plan, I think that's what we need to see.
Andy.
I would like to propose that we, as an item on this committee, as soon as possible, we get IT to present their forward plan for the website.
Thank you.
They've got a plan that can present it. So that's a
proposal.
About to ask for a formal
Agree.
proposal.
I second that, Andy.
Andrew, did you want to speak, or are you happy to support that proposal?
If I can just say, Pauline, I've seen I've seen a lot of their plan, and I've offered to work with them because it's something I did when I was actually working for a living. There's enough on there to give us a head start on what we're trying to achieve. They have got a lot of plans to make it easier.
Right, so we've got a formal proposal from Andy. Is there a seconder from that?
Yes,
I'll second that.
Okay. Is anybody against that? Right, then that is what we shall do.
Pauline, could I just add, excuse me, when we issue that invitation, could we ask them to keep the presentation really, really short and punchy? Yep. And then, as Andy was suggesting, invite them back in 12 months' time. Then we can actually, assess, performance. But I think, 15-minute short, punchy presentation.
I thoroughly agree. I wish a lot of our officers would take that on board. Thank you, Andrew. So we will ask then for report to the committee, a short one, as soon as possible. Have we dealt with everything now in that particular annex?
No, not quite, because Sarah mentioned air pollution.
Oh yes, that's right.
And it's something that frustrates me particularly, as it's one of the key areas is Wokingham Town Centre, which incorporates my ward. There is an action plan. It's a very vague action plan, and I fear it's fallen between too many stools.
Right. So would somebody put a proper proposal forward then?
So I would propose that at least the action plan be brought to the committee with an update on progress, so that we can see what progress has been made.
That's the management committee, is it?
I think so, yes.
I'll second that.
Seconder?
Yep, I'll second that.
Okay. Can I see if anybody is against that? Or any abstentions? Then that's what we'll do. Okay. The other thing.
Sorry, just again, that's not a long presentation. There is an action plan. We want to know what's happened with the action points.
Sure.
So again, it shouldn't take a lot of time.
That's right. Yes. The other things are the children's, the community care, and the health committees. Alison, are you happy with that, or is there anything you would prefer to prioritise?
No, we're fairly happy.
Isn't that up to each of the committees to decide that?
It's on page 100. Yeah, page 100. A lot of these are just things that happen anyway. Is there anything that you think is not worth keeping on?
No, I think we'll just have to keep sort of, have a time plan for each meeting about how long each piece can have to make sure we get through things.
Yep. Lovely.
I will be going through the forward plan with Lucianne and after consulting with Carol, and then I'll probably email members.
Yeah, that would
so
be
that
a good
we can
idea.
all have some input.
Thank you. Community and Corporate Services. Is anybody on that committee? Because Guy's not here today.
I am, Pauline.
Any comments, Paul?
I've just turned.
As you've said, it's a busy committee already.
Well, I'm the vice chair on that one. So if you like, I mean, we're looking at it's a very full agenda we've got already, and we are prioritising, and we're already calling extra meetings.
Yes. Could we perhaps leave that one until the next management committee meeting, and ask perhaps Oliver if you and Guy could discuss it between you. And bring it back next time. The health one. Any comments from Ken? Ken?
Sorry, couldn't get my mute button off.
You with us? Any comments on that?
I don't think there's anything on there that I've got to really think about. We've discussed a lot of this already at the HOSC meetings, so most of the items on there are things we want.
Sure. Okay then, let's move quickly on. We've actually only got 5 minutes left if you want to finish by 10 o'clock, which we should do. Let's look at item 22, the Executive Forward Programme and the individual executive decisions. Is there any comment anybody wants to make on that?
Sorry, we're not doing agenda item 21.
Oh yes, I'm sorry. I've just noticed we haven't done that one yet, have we? Ideas for improvement.
Could I just make a few comments on this agenda item? Is that okay?
Yes, sure.
Yeah, so I just made a few comments after looking through it. It was very interesting. Thank you, Neil, for putting it together. There's a couple of things that have come up from tonight, I think, that I'd like us to take into account. The late sending out of documentation isn't helpful at all. We have enough on our plates as it is. So I think any documentation that we need to be seeing in order to help us do our role must come out 5 days before. 5 working days before. I think it's also been highlighted tonight that providing, that we have full agenda items in our agenda packs, there's very little need for officers to be giving us a verbal report in addition. Anything that they want to tell us should be in that report, and it will actually save a huge amount of time in meetings if we're doing that. I really like the idea of site visits where appropriate. It will require, obviously, some planning in advance, but there are times when that would be appropriate to see. And I know from the task and finish group we did on estate infrastructure, we did that. And sometimes it will be appropriate in larger items. I did actually put on my note, the website is a big issue in actually engaging with members of the public on this. We've obviously discussed that tonight. I think more training on certain issues is a really good idea. And I do like the idea of more task and finish groups. I know it's often said that there's not enough officer resource, but I've never actually heard that from the officers.
Oh, I have.
Okay, well, it's never been mentioned publicly. And if they are a good way of actually getting a deep dive in certain issues, I mean, certainly having been on one of those task and finish groups, it was one of the most effective scrutiny roles that I've been able to be part of, and actually having some proper recommendations because really got under the skin of something. They are really, really useful, and it's about quality. That's just my comments.
Neil would like to come in there.
Well, just on that point, Chairman, obviously we've had a number of task and finish groups, and I agree they are a very good way of getting into a detailed assessment and making some good recommendations. But the resources point is a fair one. For example, we've now taken on a huge amount of work on COVID-19, and that's going to tie down the Democratic Services team for the next few months, certainly. But obviously, we try to do everything that members want.
Yes, but you can't do everything, and I really don't think we can have any more task and finish groups, at least for a few more months. So I don't think we need to include that. I'm sorry, Sarah. I know where you're coming from, and I've been on some excellent ones, but we can't do everything.
No, I know, but I'm talking in general principle going forward right now, but in the future, we should be looking at task and finish groups because they are very productive. I'm not talking necessarily right at this instance.
I've got Paul and Andrew. Paul first.
Thank you, Pauline. Yeah, in my previous role, just picking up on the point that Sarah made, at my previous authority when I was working, if items were not ready when the agenda was published, that item would be withdrawn. It was as strict as that.
Yeah.
There was no papers being tabled or anything coming through late. It was really, really strict. Just on the ideas for improvement.
Here, isn't it? Certainly, just in the committees I've been on.
Yeah. And that had been running there for quite a number of years. So it was very, very strict. But it worked. That was the key thing. It actually worked. Just on the Devon County Council presentation, it picks up the point of scrutiny with task groups and doing in-depth investigations over several months, then reporting back to the committee and then to the cabinet or executive in Wokingham Borough's case, making the final decision. We've had several times in the last year reports come into Overview and Scrutiny Committee the day before going to full council, and that really must not happen. We've got to give it full scrutiny, which then allows that report or the documentation to be changed before it goes to full council or executive.
That could be something that the people drawing up the calendar ought to look at, I think, so there's a good distance between the two meetings. I think
one of the key issues it's making sure things are not rushed.
Yeah.
They've got to be properly programmed out.
And Andrew?
Yes, thank you. I was really pleased to see this item on the agenda. On page 106, I do believe it's very important that we look at ways of improving the process of calling for evidence and public consultation more widely. There's been some discussion about task and finish groups. I was really interested to see in the presentation the use of spotlight reviews as well. And I think that's definitely worth pursuing as appropriate. And then on page 114, I was really attracted by the example of it happened to be an EHCP report that I thought was really attractive and informative way of feeding back to the public and others on the process and the outcomes of the scrutiny. And I'm just wondering whether WBC has ever used similar formats, and this would be something for the communications team to look at. But I found this a really, really interesting and useful agenda item, so thank you.
What I'm going to do, because we are rapidly running out of time, is ask if anyone wants, because the recommendation says we have to consider the proposal. We've done that. Consider the presentation from Devon, which we've done, agree on any changes. So I'm going to ask you if you have any things that you would like to include in addition, that you very, very briefly put them forward, and we'll have a very, very quick vote on them. So if you've got some additional one to propose, could you put your hand up now, please? Nobody. Okay, then, so shall we accept the report as it is under the recommendation? Anybody got any objections to that? So the recommendation is passed. And the last agenda item, if you could just bear with me for just 2 or 3 more minutes, the Executive Forward Programme and the individual decisions. Has anybody got any comments on any of that? Or are you happy that we accept what's there? Okay. If anybody's not got any comments, Neil, you want to say something?
I just, not on that item, Chairman, but just for the next meeting in September,
Yeah.
We go to page 103. There were the COVID-19 items that the committee undertook. So
Yeah.
I'm assuming that we want to have all those on the agenda for the next meeting. We've done test and trace tonight, but there were still 3 other items. Recovery, impact on the poorest residents, and maintaining democracy.
Yeah. So what are you suggesting?
Those 3 items are on the agenda because we need to make progress on the COVID-19.
Okay, right. Is everybody happy with that? It does seem sensible. Nobody seems to be objecting, so... Okay then, Neil, no one's objecting to that, so that's what we'll need to do. Any other comments from anybody? In which case...
Can I just also say that Barnsley scored in the last minute and we're staying up, Chairman, so it's been a very good evening.
It's been a long evening. I hope everybody had their tea before the meeting started. Thank you very much indeed, everyone, for coming and for the amount of time you've put in it. It has been a very worthwhile meeting, and thank you for all of your contributions.
Thanks, everyone. Well done, Neil.
Thank you, Pauline. And I think the pre-meet was a really good idea.
Yep.
Yep.
Good night, everyone.
Good night.
Good night.
Good night, Pauline. Thank you.
Is it?